mboga hizi kutia kwenye uji nilikuwa sijui kabisa habari hizo za mboga za majani wanatia kwenye uji. Mhudumu wa afya ndo akaja akanielekeza jinsi ya kuandaalisha mtoto, ndo nikawa nalifanya kazi. Sasa hivi nashukuru najua.
Jamii ilikuwa bado haijatambua nini muhimu wa lishe, na wengi wao walikuwa hawajui lishe ni nini, namna ya kuiandaa lishe walikuwa hawajui. Kiukweli watoto walikuwa wanalishwa chakula mapema kabla ya muda. Nilimpatia elimu ya unyonyeshaji sababu nilikuwa tayari ameshajifungua, lakini nilimpatia elimu ya unyonyeshaji. Nilimpatia elimu ya kutengeneza bustani kiroba kwa yule mtoto ambaye atamwanzishia chakula kwa umri wa miezi 6 atakapotimiza.
The main and the key challenge usually it's the knowledge, the understanding, and regarding the nutrition itself and the impact that it has to the communities and to our children. So that was the key and the key challenge we had. So the project, when it came in, it really raised the awareness, and that's the core activity of these community facilitators who are staying at the local level, and that's very important for us.
Tangazo! Tangazo! Baki yote kitamnyehe! Akina baba na akina mama! Mwatangaziwa siku ya lishe!
The Hornblower's message is alerting the communities to attend a Health and Nutrition Day event. It's a platform for providing health education and integrated health services, which has now taken root in Newala and Nanyamba. The event is happening on the next day. Got access to essential health services, including reproductive, maternal and child health, COVID-19 vaccination, and health education. Guided by community health workers, the residents here took part in cooking and sack gardening demonstrations. Women and men received family planning services.
Mimi nilipokuja hapa nimepata vitu vingi kwa wakati mmoja, kama ukimwi kupima, uzazi wa mpango, nimepata maelekezo ya corona na vitu vingine sana.
Tumejifunza lishe bora, tumejifundisha mambo ya kliniki wazazi wajawazito baada ya kupata ujauzito.
Tukiuzungumzia huu mradi ambao ni mradi wa Benjamin Mkapa uliofadhiliwa na UNICEF katika halmashauri yetu ya mji Nanyamba, umetusapoti pakubwa kunyanyua hali ya chanjo, kunyanyua hali ya lishe, kunyanyua pia hali ya wajawazito kupata elimu ya kuwahi kliniki mapema, pamoja na huduma zingine zote ambazo za kiafya tulikuwa tunazipeleka vijijini, kutokana na mizunguko ile ya huduma ya mkoba ambayo tulikuwa tunafika katika maeneo ya mbali zaidi, ambapo mara nyingi vituo vya afya watu wake hawawezi kufika kule. Imetusaidia sisi kunyanyua kiwango cha chanjo, warao kunyanyua kiwango cha hali ya lishe, pamoja na wamama wajawazito kuwahi kliniki mapema.
Ladies and gentlemen, the test is over, as I promised, and we are back on track. That was a deliberate test. We are now back on track because we have to do a run-up before our event, so it's just in case the electricity goes off in the middle of the event, what will we do? So we had our rehearsal, and thank you so much for, for bearing with us. We are back on track, and I'm told that our chief guest, the first vice president, is about to enter the room. He's finishing to tour the last exhibition booth. So as I asked you before, once he steps in, I ask you to stand and to receive with a round of applause. He'll come straight forward to the top, and thereafter soon we'll start our program. So karibuni sana. Bibi na mabwana, karibuni sana. Shughuli yetu ya leo, Mheshimiwa makamu wa kwanza wa rais anakaribia kufika ukumbini. Anamalizia
Alikuwa mtoto wa 4 katika familia ya mzee William Matwani. Alipita mengi katika safari yake ya kisiasa hadi kufika kushika nafasi ya rais wa awamu ya 3 wa Jamhuri ya Muungano wa Tanzania.
Na atapanda juu, na baada ya hapo tutaanza shughuli muda wowote. Kama nilivyosema awali, tukitaka kupata staha, basi tutatumia mlango ule ule tulioingilia. Ukitoka kulia kwako utakutana na sehemu kwa ajili ya kujihifadhi kwa wanaume na wanawake. Kwa hiyo muda wote utakapojisikia unahitaji kujistiri, tafadhali jiongea huko. Lakini pia nasema kwamba tuna bahati, tumefanikiwa vizuri kuvuka uviko 19. Tuko sawa, tumeweza kuishi nayo vizuri. Watu wengi wamechanja, lakini hatuna baya, hatuna shida na wale ambao wanapenda kuonyesha upendo kwa kukinga wengine kwa kutaka kuvaa mask na kusanitize kadri inavyowezekana. Naomba mfanye hivyo. Wale ambao kwa sababu za kiafya pengine si muafaka kufanya hivyo, pia tunaelewa. Kwa tunataka kutoa msisitizo wa hayo machache. Kwa hiyo jamani, tuendelee kusubiri, muda si mrefu mgeni wetu rasmi ataingia, tuanze shughuli yetu. Asante. Katikati hapa nilimuona Mheshimiwa Simai, waziri wa utalii, naye amewasili, naomba kumtambua. Ladies and gentlemen, our chief guest is arriving in a second. Would you kindly raise up and receive him with a round of applause? Thank you so much. We may take our seats and start. Your Excellency Othman Masood, first Vice President of the Revolutionary Government of Zanzibar, Honorable Minister Nasor Mazrui, Minister of Health, Zanzibar, Honorable Minister Umi Mwalimu, Minister of Health, United Republic of Tanzania, Mheshimiwa Mama Ana Mkapa, former First Lady and spouse of the late Benjamin William Mkapa and the family, Honorable Deputy Minister Hassan Hafidh, Deputy Minister of Health, Zanzibar, Mheshimiwa Simai Said, Minister of Tourism and Heritage, the Chair of the Board of the BMF, Dr. Adlan Kimambo, Babuduni Haji, Chair of the ACT Wazalendo, Excellencies, members of the Diplomatic Corps, Permanent Secretary, senior government officials, ladies and gentlemen. It's my pleasure to welcome you this morning for the second Mkapa Legacy Symposium. My name is Togolani Idris Mavura, Ambassador. Before further ado, we should start with our program immediately. We are just on time. And it's my singular honor to welcome Dr. Ellen Kondia Senkoro, CEO of the Benjamin Mkapa Foundation, to deliver welcoming remarks. Thank you.
His Excellency Othman Masood, the first Vice President of the Revolutionary Government of Zanzibar, Mama Ana Mkapa, Honorable Ministers, Permanent Secretaries, Member of Diplomatic Corps, representative from business community and non-state actors, distinguished panelists, ladies and gentlemen, good morning to you all. Courtesy demands I should start by thanking the Revolutionary Government of Zanzibar and the Government of United Republic of Tanzania for the collaboration and support in making this symposium possible. My special thanks goes to His Excellency Dr. Hussein Ali Mwinyi, President of Zanzibar and the Chair of the Revolutionary Council, our settler, our host, and to all of you who came to join us today. I understand some of you were supposed to be on holidays, but you deferred your holidays only to be with us today. Thank you all. To you, our first Vice President of the Government of Zanzibar, we thank you for accepting to grace this event in midst of your demanding schedule ahead of you. We can't find words good enough to thank you and to say asante sana. Distinguished guests, 2 years without our beloved late His Excellency Benjamin William Mkapa has not been easy. His absence is largely felt as an ardent advocate and a formidable voice for reforms at home and peace abroad. Grieving, however, is not an option we chose. At the Benjamin Mkapa Foundation, we chose to step up and rise to the occasion. We vowed to continue where he ended, to amplify his voice and to sustain his legacy. It is the reason why we are hosting for the second time the Mkapa Legacy Symposium today and tomorrow. Distinguished guests, as a reformer, the late President Mkapa believed in partnership between public and private sector, PPP. He did not mince words on this, even when it made him sound unpopular at times. He is well remembered for introducing bold economic reforms, which translated into giving space for private sector to mushroom and grow. It was during his time, for the first time, the framework for the public-private partnership was introduced in Tanzania. He went further to establish the National Business Council as a platform for public and private sectors to interact and work together. Your Excellency, late President Mkapa's vision for public and private sector synergy is as relevant today as it was during his time in office. Taking an approach of the government doing it alone will take long to arrive to the universal health coverage targets by 2030. While working with private health providers will make the journey short, achievable, and impactful, instead of spreading thin, government resources will be optimized well by improving the quality of those facilities and services that exist, and focus on expanding services to those hard-to-reach areas where there's less incentives to attract the private sector investment. Needless to say, PPP is needed in the health sector to complement government efforts in delivering quality health services to the last mile. We have all witnessed that public-private sector partnership initiative spearheaded by the Ministry of Health of the United Republic of Tanzania and also the government of Zanzibar, with the private sector for profit and also with the non-for-profit. Nevertheless, we would wish to see more of those being further cultivated. Most times, such PPPs have been proven to be cost-effective, with high impact and highly efficient. This symposium is just about that, about how we can draw from such lessons and good practices and replicate them on other areas of health to achieve the universal health coverage targets by 2030. Your Excellency, distinguished guests, ladies and gentlemen, the partnership between Mkapa Foundation and the government of the United Republic of Tanzania and the provincial government of Zanzibar is another demonstration and evidence that partnership works. Under the succeeded vision and same inner drive to serve the needy communities, the Mkapa Foundation continues to be a trusted partner of the government, development partners, private sector, civil society organization, and the community. As a result, we have achieved to reach almost 26 million people by various supported interventions by the Foundation. The model of PPP implemented by the Mkapa Foundation in the last 16 years has registered remarkable public health outcomes. The few areas which I would like to underscore is on human resource for health. The Foundation has been actively engaged in providing technical advice and supporting human resource for health initiatives through the Ministry of Health and the regional administration and local government authorities, as well as President Office Public Service Management. We have effectively co-developed a country human resource for health programs, several of those for bilateral and multilateral partner financing. Through such programs, we innovatively employed more than 10,000 health workers that have been deployed to health facilities and communities, of which between 50 to 80% of them have been transitioned to the government employment system as from 2012 to 2022. Together, we devised cost-effective continuous professional education among health workers through digital modalities, whereas almost 34,000 healthcare workers have been trained and 11,500 healthcare workers are currently undergoing various training using this e-learning platform. Your Excellency, BMF's partnership with the government is not limited to projects and downstream interventions. We partner through the Well-Structured Policy Dialogues platform led by the government, and here in particular the Ministry of Health. We have contributed to the development of various policy guidelines and strategies, such as the National Health Workforce Volunteering Guideline of year 2020. And we are also actively engaged in policy and advocacy work, including being the Secretariat of the Non-State Actors Health Group and active in technical working groups of the Ministry of Health, as well as the COVID-19 pillar groups. Ladies and gentlemen, these are just some of our contributions in improving health and well-being of communities, achieved through engagement, collaboration, partnerships, and support from the different partners. Evidence, lessons learned, and best practices have been generated, used to inform more impactful intervention and scale up. We thus kindly request you to take time to visit our exhibition booth outside so that you can get some printed material and some more information for reference. Distinguished ladies and gentlemen, what I've simply shared is what the Foundation has been able to contribute to our health sector through partnership with our governments. But this is only a token of what could possibly be achieved if we can stretch our arms further to embrace the private sector. What we have done well so far with embracing the non-state actors and the faith-based organization should be an inspiration to seek to achieve more with the private sector. And this is the essence of this symposium today. It is why our two panels today will feature on two thematic areas, that is, accelerating strategic health transformation in Tanzania through Business Coalition for Health, and also innovative public-private partnerships approaches towards attaining universal health coverage. Your Excellency, ladies and gentlemen, today we are witnessing traditional public health facilities are confronted by limited financial resources, complex social and behavioral problems, rapid disease transmission across national boundaries, such as COVID-19, and limited government capabilities to address them. At the same time, we see readiness of the private organizations and non-state actors to come forward to accept a broader view of social responsibility as part of their corporate mandate, including public health. It is our hope and expectation that this symposium will bridge our understanding on the need to work together and achieve together. Inspired by the late President Mkapa, the Benjamin Mkapa Foundation believes that public-private partnership is the best model for tackling large, complicated, and expensive public health problems. The time is now. The time is up. Let's rise to the occasion. Thank you so much for the attention.
Thank you so much, Dr. Ellen Kondia-Senkoro, CEO of the Benjamin Mkapa Foundation. Another round of applause, please. Your Excellency, our chief guest, before I proceed, allow me to recognize Honorable Idrisa Kitwana, Regional Commissioner from the Urban West, Zanzibar. Mheshimiwa Mkuu wa Mkoa, karibu sana. Has to continue, so thank you so much, Dr. Ellen, for highlighting the what BMF has been able to achieve in the past 1 year in terms of building partnership with the government. And as you may see in our program and invitation, our theme this year is Mkapa Legacy, Resilient Leadership, Inspiring Change for All. And the change we are talking about this year is all about PPPs, Public-Private Partnership. How can we collaborate, working together to achieve the last mile of the UHC, Universal Healthcare? And for that reason, our panel today, our symposium today will feature two panels, as was mentioned by Dr. Ellen, talking about the panel one will be on the accelerating strategic health transformation in Tanzania through Business Coalition for Health. And the second one is innovative public-private partnership approaches towards attaining universal health coverage. For that matter, we prepared a keynote address. Our speaker will be our Minister of Health from United Republic of Tanzania, Honorable Umi Mwalimu, to shed light of the topic of discussion today. And thereafter, that will inform the panel that will follow afterwards. So Honorable Umi Mwalimu, Minister for Health, would you kindly join the floor?
Thank you very much, Balozi Togolani. His Excellency Othman Masoud, First Vice President, Revolutionary Government of Zanzibar, Mama Anna Mkapa, Honorable Masoud Nasor Ahmed Mazrui, Minister of Health Zanzibar, Permanent Secretaries, Ministers present, and Deputy Ministers present here, Permanent Secretaries, Member of Diplomatic Corps, representative from business, community, and non-state actors, distinguished participants, ladies and gentlemen, habari za asubuhi. It is my great honor and distinct privilege to provide a keynote speech on commemoration of the great statesman, former President of the United Republic of Tanzania, the late Benjamin William Mkapa. Everyone here understands Mkapa indefatigable work and reputation as an economic reformer, and his work on giving wider space in the private sector and privatization of public institutions which were malfunctioning and those which had already collapsed. Additionally, among many achievements in fighting poverty, President Mkapa introduced a system of dialogue between the government and the private sector to support his vision on socio-economic development. Ladies and gentlemen, Mr. Mkapa leaves behind a stellar legacy. He was a consummate politician and a leader who understood the power of private sector and knew that his country would need the support of private sector and the international community as it sought to build an inclusive economy with better services for all Tanzanians. In that regard, the theme on this panel on innovative public-private partnership approaches towards attaining universal health coverage, and the other one on accelerating strategic health transformation in Tanzania through Business Coalition for Health, align with the philosophy and desire of the late President Mkapa. Distinguished participants, after leaving the public service, Mkapa, ambitious for universal health coverage, led the establishment of the Mkapa Foundation that so far has reached millions of Tanzanians, focusing on improving rural health services, health and well-being of women, men, and children, including the one living with and affected by HIV and AIDS, pregnant mothers, and many others. We are all here to reflect this remarkable achievement. And Dr. Ellen Mkonda has outlined a number of achievements which has been foreseen during President Mkapa's service after his retirement from public work. Ladies and gentlemen, as you are all aware, governments across the world are very keen on using public-private partnership to deliver infrastructure and services in order to find more ways to meet the huge demand for financing and delivery of quality services. I understand we have panelists here who will discuss in details Tanzania's efforts and approaches towards PPP, Business Coalition for Health, and private sector participation to accelerate quality health services for all Tanzanians. Specifically on panel 1 session, we have Ministry of Health Permanent Secretary or his representative, who I believe will share Tanzania's enabling environment to attract private investment development through a solid legal and regulatory framework, establishment of a dedicated PP unit, and creation of a mechanism for the government to provide financial assistance to PPP projects. Additionally, I believe Dr. Ali Nyaga from the Ministry of Health Zanzibar will share the same towards achieving universal health coverage. I'm also delighted that Dr. Ogilo from Association of Private Health Providers in Tanzania is here and will share private sector perspective in this regard. I'm also delighted that on panel 2, my counterpart, Honorable Nasoro Ahmed Mazrui, Minister of Health Zanzibar, will share insights on Business Coalition for Health as a strategic approach for accelerating access and quality of health services. I do also recognize the presence of Prite Arora, who will share World Bank perspective on private sector involvement and human capital development initiative together with Ms. Mwamvita Makamba. And Chief Executive Officer of Aga Khan Health Services Tanzania, Mr. Sisao Conti, will share with us a journey towards a successful hospital business model in Tanzania. Distinguished participants, ladies and gentlemen, while public-private partnerships are gaining a solid foothold, it is also true that there are a lot of impediments and challenges. Although each country has its specific context and issues, we believe that 4 key areas will make them even more effective. 1, comprehensive policy, legal, and institutional frameworks that provide clear guidance and procedure for development and implementation of PPPs. 2, Good coordination among government agencies is key to attract private investors on effective delivery of healthcare services. Realistic and comprehensive technical, socioeconomic, and commercial feasibility analysis, which leads to PP investment in poor and underserved communities at all levels. Engage private sector in health project finance, a model that has shown success in many countries all over the world. Ladies and gentlemen, I believe these two panel sessions will inform and expedite the development of health sector-specific guidelines and framework for managing implementation of PPP in Tanzania, a mechanism for realizing universal health coverage. In closing, I would like once again to thank the Mkapa Foundation for their work in arranging this symposium. I'm sure it will be a very good opportunity to share the latest knowledge, experience, and best practices of PPPs. I would like to wish you all a very productive time here in Zanzibar. I look forward to meeting many of you and sharing in fruitful discussions that will help us to further promote public-private partnership, because universal health coverage is an attainable and much-needed goal, and the time to achieve it is now. May Mkapa's spirit of saving life within us forever. Thank you very much for listening.
Thank you so much, Honorable Mwalimu, Minister of Health from the United Republic of Tanzania, for your speech. Thank you for showing the way, for highlighting the importance of PPP, incorporating private sector in reaching the last mile of the UHC. We are happy to note that there's a PPP unit in the ministry, and that's a step in the right direction. And as well, we appreciate the fact that you uphold the work that Benjamin Mkapa is already doing with the government. And it's our sincere hope that the same will be replicated going forward, dealing with the private sector. Thank you also for recognizing the role of Mzee Benjamin Mkapa as an economic reformer. That's what we all know, and that's a legacy that lives with us to date. It is now my singular honor to welcome Honorable Nasoro Ahmed Mazrui, Minister of Health Zanzibar, to give his remarks and welcome our chief guest today, His Excellency Othman Masoud, First Vice President of Zanzibar. Thank you, Mheshimiwa Waziri, karibu sana. A round of applause, please, even without instructions.
His Excellency Othman Masoud, First Vice President Zanzibar, Mama Mkapa, Mama Shadia, Honorable Mwalimu, Minister for Health, Tanzania, Honorable Simai, Minister for Tourism and Heritage, Honorable Hassan Hafidh, my Deputy Minister for Health, Honorable Idrissa Kitwana, our RC, Honorable RC from South of Pemba, my PS, Dr. Fatma Mrisho, and other PS who are here, Chairman of the Foundation, Dr. Adeline Kimambo, CEO, Dr. Ellen Kondo Sinkoro, members of the Diplomatic Corps, members from international community, members of the media, distinguished guests, ladies and gentlemen. It gives me a great pleasure this morning to be here with you in this important day and important event, which signifies the need in this to recall the landmark and achievements of the legacy left to us by our late former president, Mr. Benjamin William Mkapa. Over the past 12 months, Ministry of Health Zanzibar has been benefited from the Benjamin Mkapa Foundation through human resources deployment. Benjamin Mkapa Foundation provided with us 105 staff of different caliber, including 37 nurses, 10 behavioral health, 2 radiologists, 43 clinical officers, and 13 lab technicians. This staff certainly increased the level of human resources in our primary health centers in both islands of Unguja and Pemba. This has definitely reduced enormous pressure and workload for the existing staff in healthcare centers across Zanzibar. These human resources support enable us to provide improved health services at the community level, where this service is most needed. This was a milestone towards our mission and vision to strengthen our health system and provide the people of Zanzibar better quality of health care. Excellencies, ladies and gentlemen, moreover, while the ministry is undergoing staff recruitment process, the Foundation has agreed to extend the period of employment of this staff for another quarter to ensure continued service is made available. This is a true expression of passion of his legacy to make sure that the goal of the Foundation is not compromised at all. Excellency, ladies and gentlemen, since its establishment, Benjamin Mkapa Foundation aimed to supplement and complement the development efforts of the government of the United Republic of Tanzania, which aim to close gaps and enhance healthcare needs to the Tanzanians. Excellency, ladies and gentlemen, I would like to inform the Foundation that Ministry of Health in Zanzibar continue to thrive to provide best level of health, best level of health care to the people of Zanzibar. Nevertheless, there still has unmet needs that will do with the support, of course. These include, but not restricted to, healthcare workforce and biomedical tools to ensure we close gaps in our healthcare professionals and diagnostic tools. Secondly, service delivery system by improving access to information for evidence-based intervention with high impact. And another one, health financing, the solution which will accelerate access to healthcare-related services. Health governance is very important, enhance leadership and governance for quality health service delivery. Excellencies, ladies and gentlemen, the Revolutionary Government of Zanzibar, under the leadership of His Excellency Dr. Ali Hassan Mwinyi, intending strictly to work with the private sector in order to produce a better or to give a better services to our people. I understand, and I'd like to argue to my staff in the Ministry of Health, they are getting severe allergy when they hear that private sectors are going to be engaged in public health. Please, we have antidote of allergy, don't worry. We need private sector. We have to work with private sector so that we give a better service to our people. So I want to ensure that we are with you and we are going to work together with private sector, not for any reason whatsoever. It's only to provide a good services to our people of Zanzibar. Our government is working hard in putting in place proper infrastructure on health. As you know that now, we're continuing in the construction of almost 10 district hospitals in our 11 districts, as well as one regional hospital under this IMF program. And by the end of this year, all hospitals are going to be open and they're going to work. This is a very big achievement of this government under His Excellency Dr. Hussein Ali Mwinyi. And not only that, by putting infrastructure together, proper infrastructure from the community level, primary health care, to district level, to regional level, up to referral, is going to be the most and the best infrastructure ever been in Zanzibar before. It's not only infrastructure, but what we're planning now, we have a proper strategy. All this year have been doing research on medicine. We understand that a lot of complaint about medicine, availability of medicine, essential medicines in our hospitals. But this is going to be resolved within a very short period from now. Arrangements are on the way, everything in the pipeline to see that whenever these new hospitals are going to be opened, there'll be no problem on medical consumables as well as medicines. All will be available. Not only that, but also employment is on the way. We'll have employment of all the staff in all hospitals to make sure that our people are attended better. Skills, capacity building, together with our international community and supporters, we are going to train our people so that they change their minds. They have to know the value of our people. And the only way is to give them skills on customer care. This is what we are lacking in our hospitals. Our staff, they have to change their mind that customer care is very important. And that's why we want private sector to work with us so that we change mindset of our people and see that customer care is everywhere in our public hospitals. So this symposium is very important. It has come to us very timely, that here we're going to discuss about the partnership between private and public sector. This is very important. And I believe that all of us, we are going to be very, very eager to know and to learn and to implement. After saying so, finally, I would like to express my gratitude for the noble contribution that this foundation has made to the people of Zanzibar and Tanzania as a whole. The legacy which will continue to live with us and embraced by many Tanzanians, generations in generation to come. Thank you so much for your continued support and collaboration. After saying so, I say thank you very much for listening to me. Welcome to Zanzibar and good morning.
Oh, another one. Another round of applause, please. Thank you so much, Honorable Mazrui, for your speech. Yes, exactly. I was calling you to ask you to do that, just that.
I'm sorry, I was excited because all of them were clapping their hands, and I was excited. I haven't forget. After saying all that I have said, now I would like to welcome His Excellency, First Vice President of Zanzibar, His Excellency Othman Masood. Welcome.
Chairperson of the foundation, Dr. Kimambo, Mama Anna Mkapa, Mama Shadia Karume, honorable ministers and deputy ministers present, our hosts, Regional Commissioner for Urban and West, members of the Diplomatic Corps, permanent secretaries and deputy permanent secretaries, representatives of the civil society organization, distinguished guests, ladies and gentlemen, good morning to all of you. And very much welcome for those who are coming outside Zanzibar. It is the best time to visit Zanzibar. Actually, if you want to see Zanzibar, then you come in June and July. And they say if you want to eat Zanzibar, come in December. It is my pleasure and great honor to address this August gathering in marking our thoughtful gratitude to a person who transformed our country in many aspects through his leadership that embraced with economic, social, and political reforms, His Excellency late Benjamin William Mkapa. This day has brought us together to reflect on his efforts to improve the performance of the health sector, which is a shining light of hope to all Tanzanians, especially those who live in remote and underserved areas. Distinguished ladies and gentlemen, today we are gathered to celebrate and commemorate the legacy of His Excellency late Benjamin William Mkapa for the second time since he left us. These 2 days will be used to honor his life and embrace his vision on improving the socio-economic fortunes to get millions of our women and men quality health services. His Excellency late Benjamin William Mkapa pursued economic recovery programs, robust macroeconomic policies, coupled with the structural reforms and privatization policy initiated by his predecessor. His administration achieved macroeconomic fundamentals, which in turn had boosted investor confidence in the country and also in the government of the United Republic of Tanzania. It was due to those efforts that today we are gathering here to make these reflections and strategize on the role of private sector in bringing about socio-economic development through investments in health sector. Ladies and gentlemen, the late President Mkapa played a central role in strengthening accountability institutions, transforming the public sector, which consequently incentivized the growth of the private sector. I've been informed that through this platform, participants are going to discuss and share the policy and strategic views on building resilient socio-economic development policies and systems, while enhancing social protection for health through mutual strategic partnership between our two governments, both nationally and internationally, development partners, private sector, non-state actors, and communities. We know that 2 days platform is not enough for exposing all the legendary contributions by His Excellency late Benjamin William Mkapa pertaining to these aspects of socio-economic development. But do hope that quality assertive discussions will activate us courageously into following his sense of pragmatism and the sense of direction. Ladies and gentlemen, our two governments, the Zanzibar government and that of the government of the United Republic of Tanzania, recognize the role of private sector to accelerate socio-economic development and attain sustainable development goals in our country. It is from such understanding that the two governments are redefining and institutionalizing our strategic partnership with private sector and non-state actors in the implementation of strategic government priorities so as to embrace the vision of late Mkapa in public-private partnership. Together, we have made a strong foundation for PPP, and in consolidating the gains made in various sectors, the two governments continue to commit the support and to support the investments of private sector in accelerating the economy by setting good policies, review our governance and leadership structures, supporting innovations, and creating conducive working environment for the mutual benefit of all the parties. This has enormously proven to be beneficial consequences. Ladies and gentlemen, the governments recognize that greater private sector and non-state actors' participation through business coalition and PPPs in providing efficient, reliable, and affordable services is fundamental for broad-based growth and sustainable health services. Despite several significant gains in our economic and social sector, our country is in defining its vision on PPP by inviting more strategic investment from the financial sector to invest in health and support in other multi-sectoral priority areas, especially the health services. This will help to address, among other things, the change of health issues pattern we are all witnessing today on increased cases of non-communicable diseases, high death rates of women and children, and the weak systems in addressing epidemics and in preparedness for disaster management. Various health sector systems challenges, such as limited access to health care due to weak infrastructure, human resource for health shortage, limited access to relevant health technologies, plus many others, are some of the key problems that hinder the progress to achieve universal health coverage. That is where the relevance of the dialogue to be conducted through this forum lie. I believe that through the dialogues that are going to be done today, our country will make use of the constructive recommendations to address barriers toward attaining of universal health coverage and overall socio-economic development. It is from that background I take this opportunity to express our sincere appreciation to the Benjamin William Mkapa Foundation for being strategic partner in health sector. Through its initiatives and dedication, we have witnessed their significant contribution in health system performance, especially in infrastructure, human resource and health development, and deployment aiming at accelerating delivery of quality health services in areas with high demand of health services, both in mainland and Zanzibar. Undoubtedly, the foundation has so far lived to the creed. Undoubtedly, the foundation has so far lived by the creed, aptitude, and legacy of the man who we so much revere, the man who wrote his own obituary, and that is Benjamin William Mkapa. Ladies and gentlemen, the government will continue to provide an appropriate enabling environment to guide public and private sectors, donor community, and other stakeholders in PPPs on health and invest on innovative, workable solutions that will transform healthcare systems, particularly for our women and children, and reaching out the underserved population. We highly appreciate the late Benjamin William Mkapa for his vision that established this foundation, which is now contributing to the legacy we are celebrating today. Ladies and gentlemen, let me conclude by the words of His Excellency President Mkapa on his keynote speech during the SADC public lecture in 2019, where he said that we must resist the temptation to build walls and bridges. The adage that good fences make good neighbors is anti-ethical to the common destiny and common route we have chosen for ourselves. And with this, please allow me to officially open our first day of Mkapa Legacy Symposium commemoration, and I wish you all a pleasant moment and deliberation during the discussion. Thank you very much for your undivided attention.
Thank you, Excellency. May you take the floor, please. Another big round of applause. May I be seated? Your Excellency, thank you so much for your powerful and excellent speech that you gave us. You have energized us and you have shown us the way. Thank you for acknowledgement of the role of His Excellency, the late Benjamin William Mkapa, as a reformer, the man who built accountability and steered reforms of our public sector, which created a good environment for the private sector to flourish during his time until today. We owe him so much. You spoke about the commitment of government of Zanzibar to further the role of the private sector, which is very much welcome. And coming from you, it's a good accent that we wish to hear. So thank you so much for that one. We thank you for your commitment that your government is supporting innovation and creating supporting environment for private sector to enter into the public health. You mentioned the challenge of access to the healthcare, human resource for health and technologies to achieve UHC. And you mentioned that timing is right, and we cannot agree with you more. The time is now to do that. And bridging private sector is the best way to go to make our journey shorter than expected, because 2030 is not too far from us. Thank you as well for acknowledging that this foundation is living to the creed and the name of the man who created it. I think we all agree with that one. And with these remarks, may I now allow you and the people accompanied you in the stage to relieve you to go back to the floor, to take your seat, so that we can now pave way to the panel that is to follow. So, Your Excellency, could you kindly assist to take Excellency to these seats? As we proceed, as His Excellency is taking his seats, the next to us is the panel. We are going to a panel one, and as I mentioned prior, this panel is about accelerating strategic health transformation in Tanzania through business coalition for health. Accelerating strategic health transformation in Tanzania through business coalition for health. And to lead this panel is none other than Honorable Faustin Ndugulile, Member of Parliament of Kigamboni, former Deputy Minister of Health, former Minister of Communication Technology, and a man who has a long association with the public health in Tanzania. By profession, he's a doctor himself. Honorable Ndugulile, could you kindly take a floor? Would you rise to the stage, take a floor, and I leave it to you to introduce and invite other panelists. Thank you. Welcome. Would you kindly welcome him on the stage, please? The floor is yours. The floor is yours.
Thank you very much, Honorable Togolani. Your Excellency, Othman Masoud, the first Vice President of the Revolutionary Government of Zanzibar, Ministers for Health of the United Republic of Tanzania, Honorable Umi Mwalimu, the Minister for Health, the Revolutionary Government of Zanzibar, Honorable Nasoro Ahmed Mazrui, ministers here present, the RC, Honorable Idrissa Kitwana, former First Ladies led by Mama Mkapa and Mama Karume, board members of the Mkapa Foundation led by Dr. Adeline Kimambo and the CEO, Dr. Ellen Nkondia Senkoro, distinguished guests, ladies and gentlemen, all protocols observed. I'm going to lead the first session, which is titled Accelerating Strategic Health Transformation in Tanzania through Business Coalition for Health. Now, I would like to call one by one the panelists for this session, and I'll start with the first panelist. He has a business background. He's an engineer by training. He's been involved in the business of hospital construction here in Zanzibar. He's been the president of Chamber of Commerce for over 8 years. He has served a number of bodies, including in private sector. He has operated hospitals here in Zanzibar. He entered politics in 2010, and he has formerly served as the Minister for Trade, Industry and Marketing for over 5 years, but he is currently the Minister for Health in Zanzibar. So I would like to call to stage Honorable Minister Nasoro Ahmed Mazrui. You're most welcome. The second panelist, she's originally from Tanzania and currently serving as group head of external affairs for Vodacom Group based in Johannesburg, South Africa. She has accumulated extensive knowledge in the telecommunication industry and emerging markets. She has extensive business experience in Africa. Her role has primarily been to support government and private sector in Sub-Saharan Africa, establishing productive society using technology and the focus on health, agriculture, finance, services, and education. She's a graduate of University of Dar es Salaam, and she has a master's in policy and international relations. So welcome, Mwambita Makamba. Our third panelist, she's a medical doctor by training and a senior public health specialist with over 42 years experience in clinical public health and leadership experience. She's currently working with Aga Khan Health Services as a health specialist for capacity building and community engagement for Tanzania Comprehensive Cancer Project, TCCCP. She was a formerly Assistant Director for Non-Communicable Disease within the Ministry of Health, Tanzania mainland for over 10 years. She's also former Director of for Health Promotion at Women and Mandeleo Foundation, WAMA, an entity of the former Fourth First Ladies, Fourth First Lady. And she has also served as Executive Director for the Medical Women Association of Tanzania, MEWATA. She has trained in medicine in the former Soviet Union and public health from the University of Melbourne. Welcome, Dr. Sarah Maongezi. Our fourth panelist is Ms. Preeti Arora. She's the acting country director for World Bank, but she also serves as operation manager for World Bank Eastern and Southern African region. She is a senior country economist in the Poverty Reduction and Economic Management Unit of the World Bank. Her work experience including work in the conflict and post-conflict countries, low income, lower middle income, and middle income countries. She did her postgraduate studies at the Delhi School of Economics and Washington State University. Prior to joining the World Bank, Ms. Arora taught economics at the University of Delhi. You're most welcome, Ms. Arora. Our other panelist is Ms. Charlene Baguhuna. She's the country representative of UNICEF here in Tanzania. She came to Tanzania in December 2019. She has served in different capacities within UNICEF in Ethiopia and Myanmar. She's a development professional with experience across Africa and Asia, varying countries, contexts. She began a career with the Water and Sanitation NGO in India and moved on to work with the government of India, World Bank projects. She has extensive experience as an aid manager and social development profession within the Department of International Development, DFID, in India, China, Indonesia, and Afghanistan. She is a holder of a master's degree in development economics and international development from the University of Swansea, UK. You're most welcome, Charlene. So as I introduce the panelists and the topic that you're going to cover today, which is centered around accelerating strategic health transformation in Tanzania through business coalition. And to start with, I'll start with the Honorable Minister. Honorable Minister, we have seen major transformation in health services here in Zanzibar. How is this made possible?
Thank you very much for giving me first chance. In Zanzibar, the first thing which we have tried to facilitate private sector to be involved in healthcare services is by forming an act which allows private sector to be involved. Myself, I started this business in 1991. Well, at that time, there was the Act for Private Hospitals and private involvement in private service was not there at all. But before 1995, the Act was enacted, and by doing so, we have given facilities to the private sector to be involved in giving services in healthcare. I'm very happy to say that now we have 161 private hospitals of different levels. From primary, we give them stars from 1 star, 2 star, 3 star to 4 stars. We have now about 5 big hospitals which are giving services to our people, and others, clinics, are everywhere. All of them are 161. We're working together with only one aim, is to provide good health care to our people. And the government is working well. We have our board for private hospitals, whereby we have guidelines which allow them to use whenever they operate hospitals, and we are doing inspection to all hospitals to make sure that we pave the way for them to give good services. No hindrance, no red tapes, no bureaucracy. That's our aim as the government of Zanzibar. Not only that, but also we find that now it is very important also in our public health service. We should provide also, we should also give a chance to the private sector. For example, now we've already advertised 2 tenders to the private sector to work with us on images and laboratory. This will give chance to the private sector to come to our public hospitals and engage themselves in providing services to our people. We believe that by doing so, our people will get good services whenever they arrive to any clinics or hospitals immediately. But also because we're starting universal medical insurance soon this year, and this will be very important to have all the services available at one place. So we understand that private sector, they move forward on this, and involvement of private sector on this, it will be very, very useful. We have done it already. For example, we had, in this COVID-19, we have engaged Rahisi, I think, right? We've engaged him on IT services, on COVID-19 certificates, but also Thematic and Care Alpha, they are working with us on providing COVID tests on PCR and rapid test. So all this combination of public and private sector has shown the way that in this way we can work better and we can give good services to our people. So those were the first. It's all about the history and then how much we have achieved so far. And we're working with them, and we call upon investors to come to invest on medical equipments, to come and invest on medicine, industrial medicine, also to build hospitals, not only on charity, but also on business. We have to work together and turn Zanzibar. Minister of Tourism is here. I think he can be that not only medical to our people, but also we can create medical tourism soon. Just last year, I narrated one book. There was a patient came from Nairobi, and she came here. She was seriously sick. And by coming to Zanzibar, after 3 months, she was all right. And she had to write a book about Zanzibar is a healing place, because he was depressed, she was depressed, she was full of depression. When she came to Zanzibar, she became the first person to realize that Zanzibar is the place where if you have any problem, you can come here, and healing process is very easy in Zanzibar. So I call upon the investors who are interested to invest on medicine, on medical, industry. Please welcome to Zanzibar, invest. We'll give you all the necessary incentives, better incentives than any other incentive, like construction of a hotel. For medicine, for medical, we give you better incentives. Please come. Thank you very much.
Thank you very much. Thank you very much, Honorable Minister, for that introductory remark, and which has shown what Zanzibar has done and the transformation that is going on in the health sector and the work that you're currently doing. So my follow-up question, Honorable Minister, is that one of the challenges that I'm seeing is the accessibility, availability, and affordability of health services. With the perspective of engaging the private sector, how do you manage to do that? Providing quality and affordable health services with the engagement of the private sector?
You know, first of all, we have, even when we're starting this universal medical insurance, we are first dealing with formal sector. Formal sector, it will be very easy for them to be enrolled in universal health insurance. And then we'll cover informal sector. For the time being, we are covering both. Those who have money to pay for their medical services, they're depending upon us. And we give them free services, but they can pay. And those who cannot pay also, they come to the same hospital. But I believe that those who can pay now, they travel from here to Dar es Salaam, some to Dodoma, some to India, some to other places, South Africa, and so forth. But if we provide them here in Zanzibar, it will be easier for them. And the income, which is now getting lost somewhere in South Africa, it can be maintained here in Zanzibar. Not only that, but we charge from the rich and we pay to the poor. That's the system. Not only that, but also we can see that we have learned a lesson. A lesson learned is about during COVID-19. Even if you're a multimillionaire, you will die because you don't get oxygen. Even a multimillionaire, you will die because you cannot travel even from here to India. So by providing services in our country, enriching our services of all caliber, where in paying, I don't mind if somebody is going to charge more, there'll be competition of rates. But in any case, COVID-19, we have learned a lesson that you cannot travel, you cannot go anywhere. Let us establish our own sources here in Zanzibar and make ready. If any pandemic occurs, we can serve our people of every caliber. Those who have plenty of money will give them services. Mnazi Mmoja is going to be rehabilitated. We'll have more than 100 rooms, VIP rooms, whereby people with money, they can be treated and they can pay well. And all others, like me, will be treated in other hospitals according to their caliber. So there'll be no one left. All will get health service. Access to health service is for all, without any discrimination whatsoever.
Thank you very much, Honorable Minister, for that very encouraging and a very positive news. Now I'd like to turn to Ms. Mwavita Makamba. You have had numerous roles in technology development and leadership across Africa. How do you see the role of the private sector in health service delivery?
Thank you, Doctor, for the question. And let me just give a bit of context. I know I sit here as Vodacom Group, and most of you know us as a telecom provider. Your ability to speak to each other, SMS, or send M-Pesa. But I want to tell you that we have now moved. We are a proper technology company. We have bought many other companies that support us deliver services in healthcare, in education, in agriculture. So we are using digital to support economic development in the African continent. So as I speak, don't just think of us as a mobile operator. Now with that, there are so many things that I think a private sector can support in healthcare. But I'll speak about a couple for this context. One is pure investment, cash in the sector, in various programs, and we do that. We have our CSI, we have social responsibility, etc., and we put some money and we can invest in programs, something that we do. And many private sector do that. But I think there's an opportunity now to do it together. If Vodacom has $1 million, CRDB has $1 million, and we want to work with Honorable Minister Mwalimu, if I put $1 million, it won't work. It will not achieve the scale that we want. But if together we do it, we have $2 million. And then we go to the World Bank and say, why don't you match it? It becomes 4. Then we make a proper impact. So there's an opportunity there, and I think this is a movement and we should encourage that. Number 2, which I think is most critical and where private sector can make a much bigger impact, depending on which industry you are, we all have an ability to deliberately innovate. And this is a key word, deliberately innovate around key problems and find solution for them. So we innovate, we invest, and we create various products and services that are affordable, that support healthcare delivery to people and to the last mile. And I speak from a tech perspective. We're a technology company. There is many products and services and many programs that we support today that really support healthcare. And I'll give a few examples. Most of you, I think you've heard our formal launch of M-Mama program, and I want to commend my sister, Honorable Umi Mwalimu, for her formidable leadership in this. It's a program that it's a program that we created a few years ago, an app. We put some money, we put a program around it where we support pregnant women who need emergency access to care. If they don't go to the hospital immediately, they may lose the baby or they may lose their lives, right? So technology together with a program. And we've done this, with many aids, deliberate innovate around issues. we have a program, a platform, a digital platform called Stock Visibility Solution, which today we are doing it in Nigeria with the Nigerian government, Ministry of Health. We're doing it in South Africa for the last 15 years in all 37 healthcare facilities in their country, and we're doing it in Zambia. And my sister here has also heard about it, and we're busy talking to the Ministry of Health in Tanzania, and as we speak, our team is in Dodoma. They're doing gap analysis on how we can do this. What the solution does is it allows you to be able to see how much medicine is available at every healthcare facility, however rural, at real time. So instead of manually taking stock of medicine, going and do data entry, it syncs. Somebody has died of malaria because there's no medicine in Namtumbo, but there's medicine in Dar es Salaam. So this is digital. Every Friday they do stock taking using that and the platform. Very easy, it uses Edge, you don't even have to have 4G, and it all syncs and supports the broken value chain of medicine. Digital, easy, but it's possible. And we're doing this today and saving a lot of lives, which would have otherwise be lost because there's really no medicine, but it's there. Okay? So things like that do exist, and I think if, as private sector, deliberately do these things and invest around social issues that are inherent for the African continent, we can do it, and it's being done.
Thank you very much for that very insightful comments and how the private sector can be engaged. But the private sector has relied only mainly on corporate social responsibility as the mainstay of improving social services around communities in Tanzania. And in your opinion, is CSR working? And if not, what can we do better?
Thank you. So, look, I think CSR worked, and you know, we come in as private sector, we save some money, we put some money there, and we do bits and pieces. But those days are long gone, right? Now, as private sector, we are mandated by our existence to do impact in where we operate. There's a big rating, it's called ESG, where all of us globally are going that way. Our success is no longer how much money we make in the market, our EBITDA margin looking fantastic. Our success is really the impact we make where we are, using what we do. So it's a fantastic shift. We're already there, right? And we have given ourselves, as private sector, what we call a social contract, like a soul. When we're in Tanzania, we will make an impact. It's not wishy-washy here and there. We will partner with government. We will solve an issue where you can see the changes. So this is where the world is going, and you will see if many corporations have not moved there, they're still in CSI, they are backwards. And I think together, private sector, government can really, really transform our societies and help our people. And we're already there, we are mandated. So that's fantastic. Where is the opportunity? Again, collaboration. We can have the money because we are mandated to have some money, which is now much bigger than what CSR was. It's a percentage of how much money we work, our operating costs, how much we put there. So it's substantial, right? And on top of that, we have technologies, we have other innovations that can come together with the investment we put. But we cannot do that ourselves. You all know, I can have all the money, but if government is not coming to the table with us to say, look, this is our challenge, it can be solved the following year. Because money is not enough. Sometimes mostly you need innovation for efficiencies, to digitize most of this stuff, because that's where the world is going. And I think we are there already. Our company is already there. So we're just asking for support to work with government. We're here. We have the resources, we have the tech, we have the money that we are mandated to have to support our societies. But that's where we are now. Social responsibility gone, social investment, what do you call it? Shared value and social contract is the future. Thank you.
Much. We are hearing new terminology, social contracts, social corporate social investment rather than corporate social responsibility. Thank you very much, Mwambita, for that very insightful information. Now, I would like to move on to Dr. Sarah Maongezi, who is representing the Aga Khan Health Services. The Aga Khan Health Services is an example of the private sector engagement health services delivery in Tanzania. It's a non-profit organization. It does provide private healthcare here in Tanzania. How have you managed to be a major private sector player in the health services service provision here in Tanzania? Can you just tell briefly how you've managed to do that? You're welcome.
So thank you very much, Honorable Dr. Faustin. So Aga Khan Health Services Tanzania is one of the agencies of the Aga Khan Development Network. And it has been there, its existence is almost 93 years in Tanzania, because the first clinic was established in 1929. And it underwent several expansions, but the major one was in 2018, which transformed the 70-bed capacity to a 170-bed capacity. And that expansion went along with other transitions, like the cutting-edge technology, providing super specialized services, and capitalizing in human resource. But the Aga Khan Health Services Tanzania has outreach health centers. There are 26 of them, with the main hospital at Dar es Salaam, but they currently upgraded one at the district level, the Mwanza one. So these health facilities are complementing the main hospital in Dar es Salaam in the rural areas or just closer to the communities. But the main mission of Aga Khan Health Services Tanzania is making sure that we are complementing the government, especially the Ministry of Health, in the provision of healthy quality of health services. So in trying to strive to deliver the quality of healthcare services, we embarked in a joint commission international accreditation. So the first one was in 2016, and I'm happy to say that Aga Khan Hospital is the only facility which has that prestigious gold standard accreditation from the US. And in order to maintain that quality, this accreditation happens after every 3 years. So in 2019, again, we needed to do the recertification, and we are happy to say that we received again that certification of Joint Commission International Accreditation, that is JCIA. And currently, in 2 weeks to come, we are about to undergo the third recertification. And I can confidently say in front of excellencies in front of me and the delegates that we are going to attain that certification. Yeah, so in a nutshell, we have done a lot of expansion, transitions, but this is the major one, transiting from infrastructure, investing to providing super specialization, but capitalizing in human resource and definitely the quality of services. Yeah, thank you.
Thank you very much, Dr. Maongezi. Aga Khan hospitals are seen as being very expensive and out of reach to many common people. Now, how is Aga Khan Health Services positioning itself to provide affordable, quality health care to the majority of the population?
Thank you, Honorable. I can hear people smiling and laughing. Thank you very much.
I've asked the right question.
So it all depends how you weigh the expensive something and the quality of whatever you're going to take. But all in all, Aga Khan Health Services Tanzania has these satellite or outreach health centers. And these health centers are placed to the community, closer to the community. And we are also using a model, innovative model called differential pricing. So this means if you are seeing a consultant in Tandika or in Temeke, the same consultant you are going to see in Masaki, the price is different. In Temeke and Mbagala, the cost will be maybe 3,000, but in Masaki, they'll tell you 12 or 20,000. So we have tried to work on this model of differential pricing. But the second point is we do a lot of camps, and these camps are free of charge, and I really commend Mheshimiwa Mama Umi Mwalimu when we conducted our screening camps called Don't Wait for October. That's a camp whereby we screen women for cancers, cervical and breast cancers, but the breast cancer is usually in October, and most of the organizations will wait till October. But that woman, that disease does not wait till October.
start from improvements current health and education outcomes shape the productivity of the next generation of workers. And the Human Capital Index has 5 indicators. One is child survival, second is adult survival, and third, the years of schooling, the harmonized learning outcomes, and then starting. So the 5 indicators that are provided in the index. And we've done that for all countries.
Members of the World Bank, and the Human Capital Index for Tanzania is actually estimated at 0.40, which means that children born today will only be 40% as productive as they could have been as adults had they enjoyed complete quality education and full health. Now this is really not a high number, 0.4. While it is at par with sub-Saharan Africa, it is lower than what it is globally for lower middle income countries, which, as you all know, Tanzania attained the status of lower middle income country in 2020, and it is much lower than the global average of 0.56, which really places Tanzania in the bottom 35 countries globally in terms of human capital. So there is a lot of scope for Tanzania to improve its human capital, and the role of the private sector is absolutely critical, and we've heard that already, and we can talk a little bit more as we go on how we can achieve this improvement in human capital, which is really essential to position Tanzania to move to the next step, to move from lower middle income country to a higher middle income country. We have to have a human capital at a higher level and comparable to what we see in other middle income countries.
Thank you very much, Priti, for that very insightful information. And you mentioned that human capital index is at around 0.4, which is really below what is expected of us. So my follow-up question will be, given these indicators and given these results, what investment should the government of Tanzania and the revolutionary government of Zanzibar do to improve this human capital index, and how can the private sector contribute towards this?
Okay, thank you. So I think, first of all, I would say that it's really important to invest in building a partnership with the private sector. I heard very strong assessment from Honorable Minister here of how you're engaging with the private sector and bringing in the private sector. So I think it is really important to invest in that partnership. It's not just it's not just right to expect the private sector to just come in. The public sector is really important for the private sector to be playing its part in this very, very critical area of human development. So on the part of the government, of course, there has to be essential public expenditures that have to be incurred, both in health, in education, in nutrition, food security, in building skills in particular. These are all important investments that need to be made by the government, but we all know the government's budget is not infinite, and the needs are way more than what is available to the government. So it's just very, very essential for the private sector to be engaged. And I understand that the private sector currently does provide about 40% of health services. So it's already engaged, but the question is now, how do we make that investment more productive? How do we make the results be more pronounced by the engagement of the private sector? And we already heard even Honorable Minister Umi also said that it's important to have the foundations for the private sector to thrive. So the policies, the legislation, the legal framework, that really, the certainty in the policy environment, the stability there, for giving confidence to the private sector to engage, to make investments from their side. So it is, what I would say is that there are some areas where we can expect a bigger role from the private sector in the human development, and that is in skills development, for instance. That's one area where the private sector can play a big role in providing these, the training and the building the capacity, and the skilled labor force, especially in the health labor force. There is a lot of opportunity for the private sector to come in, and then also in the manufacturing, in the pharmaceutical industry, there is a big role for the private sector, and we also have really like to see the private sector provide to come in more on the on education. So there is really scope, but what we need is for the government to provide that foundation for the private sector to be confident about engaging and having policy and regulatory framework that provides some certainty to the private sector is really critical in that regard.
Preeti, now I'd love to move on to Charlene. Preeti mentioned about the human capital index being 0.4%, and you also mentioned the issues related to nutrition and childhood development. And you being in UNICEF is an entity that deals with the nutrition and the child development. Now, my question to you will be, as you know, that Tanzania is being faced with the double burden of malnutrition. We have a problem with the undernutrition, but also the problem of overnutrition. And there's not enough budget that is being set aside to address the problem of malnutrition, but also childhood development. So what can the private sector do to bridge this gap or complement the efforts of the governments?
Great. Dr. Faustine, thank you very much. Let me pedal back a little bit from what you said. And you're absolutely right. Tanzania has actually made huge progress when it comes to stunting reduction. We're down to almost from 42% to 30% of children under 5 stunted. But there are two other issues giving us what's called now the triple burden of malnutrition. As you rightly pointed out, if you look at women in the reproductive ages, 15 to 49, levels of obesity, overweight are at 30%. Can you hear me? Yes. Yeah? Okay. Okay, is this better? Yes, okay. So I was pedaling back a little bit and saying, absolutely, Tanzania does face huge issues around malnutrition. It's made excellent progress on reducing under 5 stunting. We're down from 42% to about 30% of children under 5 stunted. You rightly said, Dr. Faustine, we've got this burden of overweight, obesity, really pressing, especially amongst women in reproductive age group 15 to 49, where it's almost at 30% women being overweight or obese. And then we have a triple burden, which is in the same age group, 30% of women not having enough micronutrients. So that's one set of issues I wanted to start off with. And I also want to place one more issue on all of our minds. To achieve the potential that Preeti was talking about of every child, we have to keep children of today in view, so almost 23 million under 18. We'll have 30 million under 18 very soon. And then at 2050, we'll have doubled that figure in the URT. 60 million children under 18 by the time we come to 2050. So we have, whatever we do today, we have to bring the future into today. And all of you have touched on that. And the way to do is do this for ourselves, for universal health coverage, for eliminating the triple forms of malnutrition. It cannot be business as usual. We won't be able to tackle that with the tools of today. So innovation, particularly with the private sector, is key. So having said the rhetorical bit, let me give you a few very, very specific examples on how we can do this in the nutrition sector. First of all, human resources for health. Your Honorable Minister Dada Yangu, Minister Umi Mwalimu, Minister Mazrui, Dr. Ellen, you all mentioned the role that private sector can play, particularly to fill the huge human resources gap. And as our population expands, we will need to go outside to our volunteers, to our community health workers, to fill this huge gap. So that's the first one. The second is, and this was mentioned by Mamita in a different way, it's the strengthening the food supply chain. So looking at the role of the private sector in innovation, especially in a blessed country like Tanzania, which is food sufficient, we should not be having these triple forms of malnutrition. So the private sector's role, be it in processing or food fortification, transportation, last mile delivery, is hugely, hugely important. And I think we can really seize the momentum of this commitment and move forward on this. The third is nutrition commodities. And we hear, as you rightly pointed out, Minister, COVID really is making countries think of national capacity, national self-resilience. So small things from, say, nutrition commodities that can help detect and prevent, like, measuring tapes around the arms, right? Like weighing scales, or indeed vitamin A, deworming, iron folic acid. Tanzanian private sector can look at how to fill the gap here and make sure that we are, of course, in a competitive way, if it is indeed competitive to do so, expand that role. The fourth, and again, I want to come back, Mamita, to your words, promoting safe food environment. There's a huge imperative today on the private sector, not just to look for a viable market for foods, for selling food product, but really making that shared value, social contract come true in promoting food that does not promote obesity, that does not lead to overweight, that does not further aggravate the micronutrient deficiency. It has to make profit, but it also has to be a committed shared value partner in URT's development. Otherwise, the cost of burden, sadly to you, Mama Dada Umi, on reducing health expenditures, particularly for NCDs, is going to be very high. And same for you, Your Excellency. And we need to reduce out-of-pocket expenditure, and private sector will have to play a responsible and an investment role in that. And lastly, and I say this as a mother, and all of you working mothers in the room, you will agree with me that the private sector can set the benchmark for ensuring women-friendly, family-friendly policies so that every woman can breastfeed her child for as long as she wants, including at work, making those spaces available, making your workplace child-friendly, so that indeed the private sector can set the benchmarks for the public sector on this count. And I'm looking to you, Mamita, as my champion on this one. Aga Khan is already there, but I'm going to look to you to be a champion.
Thank you. Thank you very much, Charlene, for that contribution. Now, you've spoken on a number of initiatives and what can be done. But I just wanted to ask you, in your own assessment, what has been achieved? And what needs to be done going forward?
So what's been achieved, right? I think Preeti started with this. None of us would be in this room had we not had the huge leadership commitment to the social development sector, to the sustainable development goals by Her Excellency Mama Samiha, our president, what Dada Umi is doing, and the work that you're doing here, Dr. Mazrui. So huge leadership and commitment to the social sectors, without which the economic sectors cannot move ahead, right? So I think that really needs to be credited, recognized time and again, because we cannot take it for granted. Yeah. The second point I want to raise is, and we've seen this huge commitment to universal health coverage, particularly the primary health care. We heard from Ellen something very small in her speech, operationalizing the community health workers guideline. That may just be a phrase, but investing in primary health care, particularly linking the community to the facility, that can only be done by these volunteer workers at the scale that is going to be needed in Tanzania today and Tanzania tomorrow. That is the best way to reduce overweight, right? Just prevention, because we know that that's a determinant for NCD. Anemia, because we know that that's a determinant for stunting in children. So that investment, it's already high in the agenda. We need to continue to prioritize primary health care, particularly with the role of the community health workers. The third thing I want to talk about is we have excellent plans. Tanzania has world-class plans when it comes to national plans for malnutrition reduction. So there's a National Action Plan for Nutrition. There is, and we have worked on this together with Dr. Mazrui, Zanzibar Multi-Sector National Nutrition Plan. There's an excellent early childhood development plan, both for in the mainland, and we're supporting government here in Zanzibar for the Zanzibar ones. These are very consultative, they are action-based, they are costed, they are budgeted, and they have all scoped out the role of the private sector. So what we need to do now is three things: implement, implement, implement. And we need to implement while focusing on actionable results that we are achieving and hold all of ourselves to account for those results. So let me end with that. I could go on for long because I'm very passionate about this. Over to you.
Thank you very much, Charlene, for that very insightful discussions. And your passion for the primary health care and the linkages between the community and the health facilities through the community health workers, and also your suggestion to start rethinking the focus on the curative, and rather now, because we're having an increased burden of non-communicable diseases, focus on health promotion and health prevention. So all our panelists have spoken. Now I would like to take a minute or two for each of the panelists to give their concluding remark. And I'll start with the minister. You're most welcome, Honorable Mazrui.
Thank you very much. After listening to all the speakers here, I believe that all the participants here, they've got an idea of how we move forward together. And myself, I've learned a lot from all the speakers here on how we can work together, private sector and public sector, with only one aim: to make the people's lives better. The economy of this country can be better only if our people are healthier. If our people are not healthy at all, then economy also is not going to be good. So the coordination between all these parts, I think we can make the changes. Thank you very much, World Bank, for your remarks, as well as my dada here from UNICEF, and Aga Khan, and as well communication sector, that we need to use technology. Technology can save money. Technology can save time. So as far as I'm here as the Minister of Health Zanzibar, I say that cooperation between private sector and public sector is very important, real one is very important, then we can achieve our goals on maternal health, on sexually reproductive health, etc. I'm looking forward to see that private sector now, after all what we've discussed here, you will come and work with us. We'll pave the way, we'll build a foundation for you to come and start construction. Welcome. Thank you very much.
Thank you, Honorable Minister. Mwamvita Makamba.
Thank you. A couple things from me. One, there are many revolutions that have happened in this world. Industrial revolution, which Europe has led. But the revolution that is taking place now, the digital revolution, is the only revolution that Africa has an opportunity to lead, right? Technology and digital has immense power to support us leapfrog many development stages. We could be far ahead. So we must start thinking like that. We must digitize. Our governments, our institutions, private sector, development partners, let's embrace technology because it's our savior. We're sitting on a gold mine and we're not taking advantage of it. There's no need to waste 10 months. You can do things in 2 weeks today using digital. So let's work together. And we are looking, in healthcare particularly, we are looking to you, my dada, to lead us on it. We have the tools, we have the capability, we have the money, and we have the will to use digital to support economic acceleration and development in Tanzania. 2, partnerships. We're talking about it a lot, but we're not doing it. We sometimes, as the private sector, don't know where to go. Where do we knock, right? We're sitting with assets, we're sitting with value, but, and we all want to do the same thing. So you see a lot of people doing small pilots of the same thing. But when we come together, we can really, really scale and show impact. So let's have the political will, let's come together and let's build our nation and let's do stuff. Thank you.
Thank you very much. You spoke of things that I'm passionate about, the digital transformation, the 4th industrial revolution, which is really something that we can capitalize and leapfrog our progress. Dr. Sarah Maongezi, your concluding remarks.
So thank you very much. My concluding remarks, to attain universal health coverage, we need to do a couple of things. The first one is collaboration. As everybody said, collaboration between the public, private, and the partnerships. But we shouldn't forget the private-private partnership, because we always talk about the public and private, but we forget about the private-private. But secondly, quality shouldn't be, it should be a focus of our healthcare delivery. And this will only be attained if we work hard, we persevere, we be consistent, then we can maintain the quality we need at our healthcare facilities. But Aga Khan Health Services Tanzania is ready to collaborate and partner with any institution, any public or private collaborator, or in order to achieve this quality healthcare services. Thank you very much.
Thank you very much. Preeti.
Thank you. I see that Tanzania really needs to improve its human capital to have a healthy and skilled workforce, which is needed for the more skilled jobs of the future. And it will not be able to compete in the global economy without lifting its human capital in the country. And improving human capital really requires a whole of government approach. So what does this mean? It means you have a clear strategy, to have clear implementation, to remove all the bottlenecks for implementation, and involvement of the private sector, which is really key, and which is why we are here. I mean, just the fact that we have in this room the representatives from the private sector, we have the government representatives, as well as the other civil society representatives. It's really, it's a testament to the acceptance of this fact that we need to all work collaboratively to achieve the development goals, the human development goals of the country. So I would just say that we need to continue to engage, and we are here also to support the government. We are here to support the private sector, and we really appreciate the initiative from the Mkapa Foundation to bring us all together to discuss it and to hear from each other, and just wishing everybody all the best. Thank you.
Thank you very much. Charlene, you'll be there with your concluding remark, please.
Yeah, just to reiterate that if we are to sustain our low middle income country status and indeed graduate into high income country, we do need to break the intergenerational cycle of stunting. We need to address overweight, obesity, and micro deficiencies that we have. And I'm very confident that with this partnership approach, we can do it. The second is that breaking this cycle is going to mean investing in primary health, investing in prevention, reducing the costs that come out of dealing with the impact of all of these foundational issues. So we have no way to go. We have to invest. We are on the right track. We just have to do more. Get primary health care right, especially in the most remote, difficult to reach parts of the country. The third is we know what to do. There are low-cost, very high-impact interventions. I won't go into them. We know what they are. There's also nutrition-sensitive interventions through social protection, through education, through water sanitation in particular, that we can continue to implement, monitor, and tell the story of our excellent results that we are achieving. That's really important. Lastly, planning for today, but also, like I said, keeping the 60 million children of tomorrow in view, which will mean we can't do business as usual. We've got to have partnerships that are vibrant, real, and achieving results through the partnership digitally, and also through making plain old paper-based or ordinary systems more efficient, more effective, and more fast to help indeed Tanzania achieve high income status. And I'll end with saying that I'm really proud to be here as UNICEF, but as part of the wider UN system, along with my colleague Mark, he's here from UNFPA, FAO, WFP. We're committed to helping Tanzania achieve its targets and the SDGs, and tuwezeka utapiamlo kuwa historia kwa Tanzania.
Asante sana, Charlene. We've heard from all the panelists. Now I would like to invite contribution from the floor. So I'm trying to look around. Okay, I see Faiza. I will start with Faiza, please.
Thank you, and I'm very honored to be the first speaker. The first commenter. Congratulations to the speakers for their insight, discussion on the role of private partnership. I would like to provide my comments based on the experience learned during the COVID-19 pandemic. I think we all know that during COVID-19 pandemic, we recognize the important contribution of public-private partnership. Among other things, we witnessed laboratory services were outsourced and great results were achieved. I believe there is a big lesson here to move from well-written policies which are not implemented to actual implementation. And recently we've been hearing our national leaders advocating for outsourcing health services to improve accessibility and availability of health services. I believe, this is the good strategy because we all know that outsourcing health facilities, our healthcare service delivery, allows facilities to narrow their focus and provide best possible care and resources within their focus specialty. However, we should not forget that outsourcing should also consider important measure to ensure all people have equal accessibility to healthcare services. Example, in the areas of service price regulation, we should provide prices that can be affordable to all people regardless of their economic status. And then the second area we should also consider is the provision of government subsidies and use of digital system for transparencies and include, among others, related measures. So my point here is public-private policies should be well implemented. However, we need to consider some of these factors to ensure that all people have equal accessibility to healthcare services. Thank you.
Can you introduce yourself, your name and organization that you come from?
Sorry, my name is Faiza Abbas, working with Farmer Access Foundation here in Zanzibar as a program manager.
Okay, thank you very much, Faiza. I saw Sarah Simwe from the Global Fund. She's seated.
Hello. Yes, it's working. Yeah. Good morning, Faustin, Your Excellencies here present, and honorable ministers, and the distinguished panel. My name is Dr. Sarah Simwe. I work for the Global Fund as the Fund Portfolio Manager for Tanzania and Zanzibar. And I would like to thank, first of all, for inviting us to this very important occasion, and just to make a few comments on the subject that the panelists have been discussing. The Global Fund, one of the principles of the Global Fund is sustainability of the programs that are supported by the Global Fund. And what we look at usually is the co-financing and contributions that are made by governments and partners in funding the global health programs that we support for HIV, TB, malaria, and building sustainable and resilient health systems for health. With the COVID, we did expand to supporting the COVID response. For us to sustain the gains that we have made in all health outcomes, the Global Fund promotes the principle of sustaining programs through government contributions. And what we normally do is we look at government co-financing contributions when we send out allocations to countries. And I would like to announce that the Tanzania and Zanzibar have continuously met their co-financing requirements for the Global Fund to receive funding. And we really work on partnerships and support and through collaboration, both with governments and with bilateral and multilateral partnerships. And one thing that we have been, even at the Global Fund, we have the engagement of the private sector in contributing towards the Global Fund envelopes. And we do that right now. We are in our 7th replenishment where we are looking for funding to support programs. And one of the areas that we have looked at is extension to the private sector to contribute towards the Global Fund. So far, we have received funding of up to $250 million from just the RED campaign, who are private sector, and we also have the Children's Investment Fund who contribute to the Global Fund. At the country level, we want to appreciate the support that we have received. In 2017, I believe we had a very big workshop where we called the private sector through our local fund agent. And we had a campaign to look at how private sector can join governments to contribute towards sustaining health programs in countries. And right now we are exploring opportunities. Some were mentioned by the Honorable Mazrui, Minister of Health. A couple of weeks ago, my head of department met with His Excellency Mwinyi to look at some of these initiatives that have been talked about, extending support to the private sector through partnership with the Global Fund, and many other initiatives that we are pursuing as well in Tanzania. And we look forward to having further engagements with the private sector, especially because we're looking at sustainable financing. We know that both the donor money and government funding may not be they require to be also supported with the private sector contributions. And we look forward to having a line somewhere that says these contributions also came from the private sector towards the co-financing requirements that we have for Global Fund funding. So thank you. We'll join government to continue the efforts to bring everyone in to achieve universal health coverage and maintain the health outcomes that we have so far achieved and that we aim to achieve with the next funding. Thank you very much.
Thank you very much, Dr. Sarah Simwe from the Global Fund. I saw Dr. Shadrack and Minister Simai.
Yeah, thank you so much. Yeah, I would like to join my colleague in supporting their contribution. Yeah, by introduction, my name is Shadrack Scott Maibambe. I'm the President of Medical Association of Tanzania, but present with small r, not capital R. All speakers, including our government officials, top government officials, admit the importance of private sector in supplementing the government effort. For this, for private sector to excel, we need a stable policies protected by law and not a fragile policies. For any investors, in the case of any country with a fragile policies, this is going to be a threat for any investment. Investing in private sector is a capital intensive, and once you want to invest, you must invest and not gambling. So it is a long-term investment. So anyone with a good business plan, he must also calculate when is going to break even on that business. So if the policy is fragile, for example, if my expectation of my business is to break even after 10 years, and I invest in the country where the policy is very fragile, and then within 5 years or 6 years, the policy is going to change, definitely I'm not going to break even, and I'll be the loser. So it is very important for policymakers, government officials, to make sure that policies are highly protected and things are not being decided by individual political will. Today we have this minister, tomorrow we have another minister. This one with this policy, another one with the certain policies. This is a threat to investors. So this is very important. The second thing is about incentives. Incentives, you may talk from various corners. But for private sector to excel, you need a good incentives. We have been experiencing in a mining company. For example, a mining company entered the contract that they are going to start giving dividend after 10 years. But once it comes to the case of hospital, investing in private sectors, the day you open the hospital, all kind of taxes are going to be there. So we need at least to give incentive, for example, tax holiday for sometimes, because most of them are citizens. Tax holiday for some years. We need, for example, tax cut in case of medical devices. Through this way, you are going to improve the services, because even the price, the running cost of that hospital is going to be minimal. Even the accessibility to the health sector by Tanzania is going to be easy, because the price is going to be a bit low because of the tax holiday tax cut from various devices. So it is important to give incentives. It is important to have a good and stable policies for the health sector, the private sector to excel in our country. All in all, I would like to commend the good job done by BMF. Thank you so much.
Thank you very much, Dr. Shadrack. I saw Minister Simai also raising her hand. But Mr. Simai is here, at the front here. I'm the moderator, so the mic should come to the Mr. Simai here at the front. Mheshimiwa Waziri, nyosha mkono akuone.
Thank you very much. My name is Simai Mohamed Said. I'm the Minister responsible for tourism and heritage here in Zanzibar. All protocol observed. The issue of medical tourism was mentioned earlier by Minister Mazrui and I think a few others. And I just wanted to say that us in Zanzibar, we are more open now than ever to work with the private sector. President Mwinyi's government has been initiating in all sectors, not only on the health sector, but in many other areas. And I think just like, as I know many people here, Mr. Mazrui was mentioning how big Zanzibar is, and I know, Mwamvita, you are a big fan of Zanzibar. The issue of Zanzibar is a beautiful place for, we are talking about the wellness centers, but now we are open for ideas and to listen. Just like what Shadrack has mentioned, us as a government, we cannot take charge and say that we know everything. But based on the requirements, what a potential investor would like to do on the tourism side, the medical tourism, Pemba, now we have allocated Pemba Island. We have special incentives. And I think for anybody who will be interested to set up cosmetic surgery, which is a very huge industry now. People are heading to Morocco, the Middle East. And I think for those who want to improve their bodies, their faces, there couldn't be a better place than to come to Zanzibar and Pemba. I don't know. Minister Hassan, I think you want to get rid of your belly. For those, I think, can you imagine being in Pemba, beautiful green island, all relaxed there. And it could be even connected to tourism, but we have to be ready in terms of services. We still have a huge challenge in terms of how we deliver our services. So by linking the medical tourism side and for visitors to come to Zanzibar, to enjoy, to relax, but to improve whatever they want to do it, we have to be ready for the service. So I just wanted to make a note of that one, that the issue of services is paramount, but us in Zanzibar, we are more than ready to spearhead the whole initiative of the public-private partnership. Thank you very much.
Thank you very much, Honorable Simai. I know there's a lot of hands being risen, but I think we need to come to the end of our session. And I'll just summarize some of the key issues that came out of these discussions. We can see that a lot of progress has been made, both in the Revolutionary Government of Zanzibar, but also the United Republic of Tanzania in transforming health services. But we also saw that there are still some challenges in provision of quality health services, but also the area of nutrition, childhood development, but also what Preeti mentioned about human capital index. But we can all agree that based on the discussion that we've had, there's a room for the private sector. That came out very clearly. And that the private sector can make a contribution to the provision of quality health services in Tanzania. But it was also mentioned that we need to have an enabling environment. That means having stable policies, but also having robust regulatory framework. But again, what is also very important is the political commitment. And we can see that today we have that political commitment. We have the first Vice President of Revolutionary Government of Zanzibar being here. We have the ministers here. Tomorrow we are going to have President Mwinyi with us, and we're also going to have Mama Samia with us. So this shows that the level of commitment that the government of Tanzania is put in the health services. But it was also mentioned that we need to have incentives for the private sector that are contributing to social services. This needs to be quantified, needs to be to have some sort of relief for those who are giving. In other countries, they do that. But again, Mwambita mentioned that maybe it's also a time to relook the corporate social responsibility and looking at now changing to corporate social investments. So this is something that we need to look into. But what also came up is we need to continue engaging the private sector and build partnership between the public and the private sector, but also partnership between the private sector and the private sector. But most importantly, and then lastly, we need all these efforts needs to be properly coordinated. Who is going to coordinate? How that is going to be coordinated? Something that we need to look into. We have laws on the issues of corporate social responsibility in the mining sector. Do we need to have a law across board? Who is going to coordinate? Who's going to identify priorities? Who's going to manage those priorities? So after concluding all this and summarizing everything that is mentioned, I would like to thank all the panelists for very insightful and good contribution. And lastly, I would like to thank the Mkapa Foundation for organizing this symposium. Thank you very much, and thank you very much for listening.
Thank you so much, Moderator Honorable Faustin Dugulile, for the very, very wonderful panel this morning, and the panelists for your contribution. I was following closely, like many others. You did justice to the panel. That's what we expected of you. And being much involved in these kind of issues. At some point, we lost you because of the technical problem that happened, but I could follow. I was going around, I could follow. Just by the gestures and the way you were mimicking words and your hands, we could get the message that you were stressing about accelerating private sector engagement, PPP, on the health. So may I relieve you to go back to the flow? And can we give a round of applause for the great job that they have done? Now, going forward, we are going to taking a photo session. And before I introduce how we're going about, I should take this opportunity to thank you, Vice President, Your Excellency Othman Masood, for actually sparing time to stay with us and to follow the panel. Thank you for donating your time. We understand your itinerary is full, and we'll soon relieve you to go and proceed with other commitments. So I should bring on the floor, and the protocol should assist me in doing that. We'll be having two photos today. The first one will be with our distinguished guest on the front row with the board of the BMF, Benjamin Mkapa Foundation. And another one will be with the panelists. So may I invite you in front? Could you kindly send somebody to talk to me? Okay, yeah, so may I invite you in front, honorable ministers, the regional commissioner, our former first ladies, Mama Mkapa and Mama Shadia, and the chair of the Benjamin Mkapa Foundation. Okay, can protocol help us to bring them forward? Yeah, so may I call upon ministers, please take the floor, come to the stage, the regional commissioner, deputy minister, Mama Mkapa, Mama Shadia, Mheshimiwa naomba mkaribie mbele kwa ajili ya picha. Mwenyekiti wa bodi ya Mkapa Foundation, Dr. Adeline Mambo, CEO Dr. Ellen Sankoro, Watu wa kamera nadhani mmeshakaa sawa tayari. Do you allow me now to invite His Excellency on the floor? Protocol. And last but not least, Your Excellency, can I now invite you on the stage for a group photo? Thank you. Thank you so much. Yes, now may I ask those who are seated, Your Excellency, to remain sitting? And then I invite on board the BMF board to join. CEO, please remain. Members of the board of the Benjamin Mkapa Foundation, please. I think we'd move from the center, that would be better for the good optics. Yeah. Could you kindly leave from that side, from your right side? And then the last one with the panelists and moderators of today, Honorable Ndugulile, Zeka Mugisha, and the panelists, both panel 1 and panel 2. Could you kindly join us for the photo? So while we're taking this last photo, we will allow soon after that for His Excellency Vice President, First Vice President to depart. And we ask you to give to stand up and give a round of applause as he leaves the room. And thereafter, we'll be having a health break. And we have two arrangements. First of all, we will be having ministers, first ladies, the family of President Mkapa, permanent secretaries, governor of BOT, members of the diplomatic corps, panelists, moderators, and sponsor, chair of the BMF, and members of the board. Kindly proceed to the Jahazi room, Jahazi hall, which is adjacent to this place, for the health break. We'll be having 25 minutes health break. And for the remaining others, including myself, we have a tent at the back of this hall where there'll be a lot of networking and mingling, will be much more freer and much more fun. So please kindly join there. Yes. And I also acknowledge Honorable Rizwani. Please wave so the people to see you, Deputy Minister of Lands. Thank you very much for coming. Your Excellency, may I now allow you to leave, to relieve you, to proceed to the Jahazi Hall for a healthy break. It is now 11:30 and we have 25 minutes. So we're expecting you back here at 11:55 so that we can proceed with panel 2. Thank you so much for your kind attention. Have a good health break. Thank you. Asante sana mwisho. Soraga, Minister. Nice to see you. Thank you. Ushers, please help us to direct our guests to the rightful place. Those who are going to the Jahazi Hall and those who are going to the tent, kindly help us, please. We'll be back at 11:50. Thank you. Enjoy your time. encourage those who are outside still mingling to please proceed inside so that we can commence with our second panel session. Our panelists are more than ready to take us through, so would you kindly come back. Part 2. Kwa wale ambao bado wako nje wanamalizia mashauriano na majadiliano, tunawaomba warejee ukumbini ili tuweze kuanza awamu yetu ya pili, na moderators wetu wako tayari wanatusubiri sisi. just waiting for Mama Mkapa and Mama Shajia Karume for them to get in and so that we can start. Small announcements. If anyone has missed her phone, I have a phone here. It looks like this. It was forgotten somewhere. So just know that I have it in mind. I'm a trustworthy moderator. He or she will find it in a good state. So if you hear anybody is looking for a phone, it looks green, a very beautiful one. I have it with me. Safe. So, honorable ministers, excellencies, distinguished guests, ladies and gentlemen, welcome back for the second round of the Mkapa Legacy today, and we are now approaching our second panel, which will deal with the subject of innovative public-private partnerships approaches towards attaining universal health coverage. We followed the first panel, the discussion that went through, and we agree in principle that we need to find a way to make the PPP works. Private sector and public sector need each other when it comes to health. We have done a lot in other ventures, but we think health as well. If you want to expedite process and getting results quicker before 2030 to catch up with time, we need to involve the private sector. So this second panel is going to cement on the same and going to answer the how. How do we go about it? So it's my singular honor to invite Mr. Geras Mugisha Kamugisha, who will be a moderator to this session. Mr. Kamugisha has more than several years' experience of working in the public and private sector, as well as leading a team within NGOs. Skilled in policy development, research, program implementation, and evaluation, with particular focus on the public sector, education, and community organization. He is the Chief Executive Officer of the Orbit Security Company. If there's a language he understands more, is money and finance. Other positions held by him has been the Director for Research, Policy and Planning at the TRA, Tanzania Revenue Authority, Commissioner for Policy Analysis, Minister of Finance, and I see Mama Mengi is nodding. She has been Director for Planning, Research and Development at the Presidential Delivery Bureau, PDB, at the President Office, and the Director for Consultancy and Advisory Services at the Orbit Securities prior to become a Chief Executive Officer. Mr. Kamugisha, please come to the floor. And to me, is one of those mentors and the elders that I enjoy debating with him. He always has a good time to take my questions and challenges, and I'm learning a lot from him when it comes to money and finance, since that is not my area of expertise. Mzee, karibu sana, and I give the floor to you to invite the panelists and moderate the panel. Thank you. And a round of applause for him. We have energy back.
Thank you, Balozi. Thank you very much for that introduction. Honorable ministers, can you hear me? Yes. Honorable ministers, Regional Commissioner, dignitaries here present, ladies and gentlemen, we'll be leading a panel, as the ambassador just said, that focuses on innovative PPP initiatives aiming at promotion of quality universal health coverage. And the panelists in this regard will be, the first one is Mr. Jacob Kayombo, who is here representing Hodanadu, the UN PA, the UN Women country representative. Jacob, please, if you can come forward. We will also have Dr. Ali Nyanga, who is the Director for Preventive Services in the Ministry of Health here in Zanzibar. Dr. Nyanga, please. We will also have Dr. Samuel Ogilo, the Chief Executive Officer of the Association of Private Health Facilities in Tanzania. We'll have Ms. Salma Maulid, who is a lawyer, a legal consultant in governance and human rights. Please join us. And last but not least, we'll have Mr. Lusajo Ndagile, who is an assistant director in the Policy and Planning Directorate in the Ministry of Health, the mainland. Thank you. So that is the panel we have. Lusajo, because you came on the podium last, you'll be the first to speak. We have seen, Lusajo, the ministry being quite vocal in advocating the transformation of the quality of care, as both in the strategic plan of the ministry, and in many other policy statements. If you can please share with us from your experience, to what extent is our PPP policy helping in attaining that? Use the mic.
Thank you, Dr. Kamgisha. I'm Lusajo Ndagile from Ministry of Health. I'm going to discuss about the role of PPP, especially in the health sector. Yeah, basically, under the Ministry of Health, in order to implement their core function, we need the support of PPP under number of reasons. First of all, we know the issue of resource. Currently, the health sector requirement, according to strategic plan, we need around 9 trillion per year. And if you see the actual allocation as of now, we have only 2 trillion. So we have around the gap of 7 trillion. And we have about 13 priorities. So all those certain priorities, we need to implement service. So all the important things on that, we need to the engagement of the private sector in support the health intervention. Number one, for instance, when we talk about the insurance, we have the coverage of 15% as of now, out of 100%. So you can see we really need the support of private sector to cover the remaining part, because out of those 15, we have 80 from the government, 6 from CHF, but also we have 1 from private. So if we increase the support from private, at least we can cover more people on the health insurance. But also when we talk about the universal coverage, we consider the issue of accessibility and the affordability of the health service. Most of the people, they cannot access the health service because of the financial barrier. So if we involve the private sector, it means the financial barrier will be reduced, because we are going to have more health facilities whereby most of the people can be accessed. But not only that, but also the issue of human resource for health, people can access. As of now, we have a number of health facilities constructed from the private support, but also we have apart from human resource, we have the private hospital from private. So those are the issues of which you see the importance of PPP. But not only that, general at the ministry also, we are trying to implementing the PPP policy for 2009. And also if you go to the health policy, especially in page 64, we acknowledge the importance of PPP in deliver the health service. But also we use also the PPP Act for 2019, but also we have regulation for 2020. But also under PPP, it helps us also to prepare directives in investment in number of areas, especially in the health sectors. But also, it try to create to attract the investor to invest in the health sectors. But for instance, under PPP at the ministry, we have about 3 projects under the process. We have in Moi hospitals, but also we have in MSD, but also we have on Ocean Roads. All these, they are trying to support the health intervention under the PPP modality. But also, apart from that, it increased the issue of efficiency, but also effectiveness and also accountability, especially to access service in the remote areas whereby we still have the society which needed to access those services. Thank you.
Thank you. Thank you, Lusaja. Sounds like quite a lot is already happening in this area of partnership between the government, the private sector, and faith-based institutions.
Yeah.
If you can give us a taste of what to expect, what is coming. If you can give us a bit of a taste as to, in addition to what is already happening,
yeah,
what are the ministries and the government plans for strengthening the partnerships going forward?
Okay, in terms of how do we strengthen PPP at the health sector?
Yep.
Okay. Yeah. Generally, since we know the importance of PPP, there are a number of interventions which have been taking place, especially to coordinate the issue of PPP. Number one, we are planning to develop health sector investment plan, whereby we try to identify where to invest, where we get the private investor who wanted to invest in the health sectors. But also we are trying to capacity building of some staff who are working under the PPP. But also now we have established the PPP unit, and we have also a technical working group which are mandated to develop the comprehensive and the guideline and the legal framework of the PPP. But also apart from that, those technical working group and the unit which are mandated to develop realistic and comprehensive technical and socio-economic commercial feasibility analysis attractive PPP project, we operate under some intervention like service level agreement, whereby we have about 374 health facility under AFTA and FBO, but we have around 6,622 health workforce, but also we have about 154 health private training institutions. Yeah.
Okay. Thank you. I hear plans to strengthen the PPP framework with institutional reforms and policies and what? Policies and laws.
Yes.
Maybe now we can hear a bit from the private sector, Dr. Odilo. From what we hear from the ministry representative, are you happy with where we are? And if not, what more do you think needs to be done in order to accelerate the realization of our vision of universal health coverage?
Thank you very much. Good afternoon, everyone. I always find it very, very interesting. For the past 15 years or more, I've been fully engaged on public-private partnerships. And I found it very, very interesting seeing how we have developed as a country. Looking 15 years back, we made a lot of major steps. 15 years ago, or 17 years ago, it was not easy to sit and talk and understand each other. We had difficulties in achieving that. Today, it is so natural talking about partnerships between the public and the private. And to me, that's a very big step that we've taken as a country. About 7 years ago, I was in one group that's looking into universal health coverage. That our work ended up in Japan, where we presented the work, and if you remember the famous Japanese conference, UN conference, that approved universal health coverage, and they officially inaugurated. And since then, I've also been in WHO working group on private sector involvement in achieving universal health coverage. And in that group, where we're about 10 people, we have been trying to compare different countries, what they're doing, and taking the best examples. I tell you, Tanzania is one of the best examples that we take in the private health sector, working closely with the government towards attaining universal health coverage. So I can say, yes, we have made some progress. But still, on the other side, also we say, we've attained major developments towards universal health coverage with the well-developed primary healthcare system and coverage from household to tertiary care. We still have got some gaps that we need to fill. And that gap is understanding the potential and utilizing the full potential that is in the private sector in attaining universal health coverage. We know that about 40% of healthcare services are covered by the private sector. And when I talk about the private, I'm talking about faith-based and as well as non-faith-based facilities, self-sustaining together. So this means that if we understand the potential that is there in the private sector and utilize it fully, attaining universal health coverage won't be a big problem. Yes, we are utilizing it, but not fully. So we need to accept that. But also at the same time, we're talking about innovations. We know innovations usually come mainly from the private sector because they take the risk. Just example today, there's a new innovation, say, coming up of a medical equipment. The government will take some time to go through it, review, and take action after a lot of studies. But the private sector will jump into it and will like be the first one to use it. I remember in medicine, we saw ultrasound. It was found in the private sector. CT scan, MRI, everything, just mention it. They take that risk. So we talk about innovation. If we take advantage of the innovative spirit, that's the private sector, we can make a lot of progress as a nation, and we can achieve the universal health coverage within a very short time. Venture into darkness without explanation of what they're going to mean, so long as they've got a sense that there's something good where they're going to venture. And we know very well, our ministry is now working towards the implementation or on a bill for universal health coverage. We did our homework. I sat with the private sector a few weeks ago, and they are already on the drawing board, looking into how many people are utilizing the services when they're insured. Today in the country, only 30% of providers of healthcare for national health insurance are private. 70% of providers, I'm talking about facilities providing services, are public. But about 70% of people utilizing the facilities visit the 30% of the facilities which are private. And only 30% of people with national health insurance card utilize the public facilities, which are 70%. Do you get that? So the calculation goes like this. If you're going to have universal health coverage, whereby we're going to double the numbers today, just double the number, say from 13 to 26, our facilities will be flooded. We cannot contain them because people utilize facilities when they are covered than when they're not covered. You see that very clearly with those who are having insurance cards. So already we're looking at an investment, doubling our investment as soon as the numbers double. And as soon as the numbers triple, we've got double our investment. It's a huge business coming up. We see it as a big investment opportunity coming up. And we are willing to invest more in it. But for the government, we are still wondering, where will we get the money to do all these investments? It's going to be a huge activity. Go take some money somewhere else and then do it. So just say, forget about it. We are going to increase the numbers. People are going to use the facilities. Private sector take care of it. We've got a facility here for you to take the loans. The good thing about private sector, the loans, you repay it. It's not a grant. And then take care of the numbers increased. India is having a population of more than 1.2 billion now, I think. 70% of facilities is private. They're taking care of all those hundreds of millions. They take care of the population of the whole of Africa. So to me, I look at the opportunity. The government is the right. We are having all the documents. We have the PPP's policies in place. We have a very good strategic plan showing how the private sector is going to be involved in everything. We have a very good government now, I think, than any other time, saying we must incorporate the private. So now, I think the best thing we need to do now is to fully understand the potential and utilize them. So the potential is there. Thank you.
Okay, the potential is there. The private sector is ready to invest and take advantage, rise to the challenge. And but as you talk of universal health coverage, the question of affordability come in. It's quite handily. The question is, to what extent is the private sector talking in one voice when it comes to promoting, focusing on the universality of healthcare vis-a-vis exclusion of some because of affordability issues?
Thank you. Many times when we talk about universal health coverage, we think about everyone getting services and for free if possible. That's not the truth. The truth is contributing. Those who have more can actually contribute more to support those who do not have. We've got to have that equilibrium set somewhere. The government, instead of saying now we're supporting all the country for some free services, they say now no. Only those who can't afford will be supported. Those who can afford will have to pay, and the extra money they get, the others are going to use. That's how insurance works. So with that sense, what we're saying here is, for those who will be able to pay, they are going to pay for the insurance. For those who won't be able to pay, the government is going to come up with a mechanism to subsidize their cost. After doing that, the reimbursement of people providing services, they will not worry who is paying what. For example, now, a simple example, the national health insurance. There are people who have got a salary only of 400,000. Their contribution is about 20,000 per month. There are some who have a salary of 10 million. Their contribution is 600,000 per month. But all of them get the same services. So in that case, with the population and the numbers, there won't be a problem. And another thing for us to be comfortable with, which is very different in Tanzania and very peculiar, we depend on the numbers. How? All other countries in East Africa and others that are having national health insurance, they pay more for the private health facilities providers. In Tanzania, payment for national health insurance covers is the same for public and the private facilities, all the same. So what do we depend on? It's on the numbers. And the more people come in, we can actually reduce the cost. So there's no difference. So there's no difference, be it a government facility, be it a private, the cost will be the same. And I tell you, the private sector is waiting and very happy about the upcoming universal health coverage, so long as they will be included and the innovation to be accepted. So they are ready for that. And the issue about the poor and the rich, with a good universal health coverage system, there won't be a difference. Thank you.
Thank you very much, Dr. Ogilo. Talking to a guru here of private sector investments and engagement in the health sector. We can all see that. I believe and hope the future is much, much brighter than we have had hitherto. If I can now move to Jacob for Ms. Adu, who unfortunately couldn't make it, from UN Women. Adu, from your perspective and your organization, what is your appraisal of the current PPP strategies in the country, and to what extent do you think we are realizing the vision for universal health coverage, particularly for women and children?
Thank you. One of the targets for the third Sustainable Development Goal for ensuring health, lives, and promoting well-being for all to achieve universal health coverage includes accessibility to equality and essential health care services. Tanzania, with its strong ethos of equity in the delivery of health services, is moving towards universal health coverage to reinforce availability of equality and affordable health services for all who need it without financial impoverishment. This requires additional resources for driving demand-driven investment to meet the individual needs of all citizens, free from discrimination. The strengthening of the public-private partnership is a strategic option to meet the universal health coverage. Key focus on enhancing efficiency and effectiveness of health services delivery to achieve value for money. Encourage innovation and develop more user-sensitive services appropriate for a particular context. This calls for predictable and sustained flow of financial investment from innovative and diverse sources, especially in view of declining government expenditures on health to 80.9% in 2018 and 2019, and 8.8% in 2020-2021. That is constraining the government's response in reducing the gender disparities in health services delivery, which are especially critical to reduce maternal and infant mortalities. Two distinct characteristics of health sectors that are stronger gender undertone and which require an emphasis on mainstreaming gender into public-private partnership are: one, health needs vary across populations over time and across geographical areas. And second, the cost and the equality of services are determined by those who deliver and receive the services. By mainstreaming gender into these two crucial issues, the public-private partnership can ensure that the gender-specific needs of different social groups are met, while improving the equality and access to health services with a special consideration for underlying gender determinants in availability, accessibility, affordability, acceptability, and the quality of these services that profoundly influence the gender difference impact on the various social groups. Therefore, to meet the challenge of balancing fiscal limitations with expanded access to equality health services by all citizens from a gender perspective, we require innovative financial instruments which, with the objective that there has been identified in the Public-Private Partnership Act of 2010. To establish efficiency and equality socio-economic public-private partnership within the country. Thus, the public-private partnership has a potential to bridge this gap, especially in reaching out to most vulnerable groups through a gender-responsive approach. end by establishing a closer coordination of financial from the public and private sources. The public-private partnership can become the channel for ensuring the effective and efficient use of public funds combined with the dynamism of private sector for ensuring better financial accountability, gender transparency, and above all, the achievement of gender equality.
Thanks, Jack. That's quite a lot you talk about for financing and addressing the gender imbalances in access to quality health care. I wonder if you have any specific recommendations as to strategies that Tanzania can adopt for financing health provision in the country.
Thank you. We have the following points need to be considered as key recommendations from UN Women point of view. One is health systems are not gender neutral, and hence they reflect gender norms and either eliminate or reinforce gender inequalities and discrimination depending upon resources available. The accessibility, acceptability, and affordability of equality of health services. And second, with reference to available and accessible availability, the accessibility and the affordability of equality of service, with reference to COVID-19 pandemic and the recent good political development impact on accelerated price rise in food and energy risk, revealing hard-won gender equality gains. Hence, the inclusion of a gender lens in financial strategies, both the right and the smart thing to be considered. And a third recommendation is the fact that the right to health is an inclusive right that covers not only the timely and appropriate health care, but also the underlying determinants of health. Discrimination based on gender, ethnicity, and religions and other intersectional inequalities are to be found a way to be eliminated. The commitment of government in Abuja declaration in 2020 to allocate 15% of annual budget allocation to health services is yet to be achieved. So this is also another area which need to be emphasized at our local level. And maybe to conclude, one of the form of inequalities which actually need to be also considered is to find out on how injustice in healthcare is the most shocking and inhuman no, let me end there. Thank you. Thank you.
Okay. Thank you, Jacob, for Adu. Adu has been very ably been represented. Salma, I wish to turn to you now. You, a lawyer, a human rights activist, and we hear you and women talk of human rights, women rights, gender rights, and that refers me to the International Covenant on Economic, Social, and Cultural Rights, an area I know you're very active. We have heard this morning from His Excellency, the First Vice President. We have heard from the ministers, as well as from the last panel session that we had. From all that, what do you think needs to be done further to strengthen accessibility, particularly for the vulnerable groups?
Asante, habari. Na naomba radhi kabisa nsije nikafatwa. Sitotumia Kiswahili maana tushakuwa tunamrushwa tutumie Kiswahili. Lakini naona lugha ya
mawasiliano leo
Kiingereza. Mawasiliano sio ile lugha mama. All right. I don't wish to repeat what has already been ably put forth by distinguished panelists as well as speakers from the inception of this symposium. I wish to put forth the view of non-state actors who I believe should also form part of this dialogue as the other P in the PPP. But likewise, I would like to reclaim the public to not only mean those representing the people, i.e. the government, but also the people themselves. That said, I wish to mention one fact that I think hasn't been underscored enough, is that one of the key improvements that we have seen is the introduction of insurance schemes, including those that have been begun by SACCOs or cooperatives, etc., which would now represent the base. And I want to emphasize that there are a number of state actors, because oftentimes when we think about private partnerships, we only think of the Monvitas, we don't think of the others, or of research foundations. For example, in Tanzania, you have entities operating as organizations, you have networks, you have coalitions of health. Some of them are outside, like TMARC, you have Zayadesa, you have Sikika, you have Takare, a program of the Jane Goodall Foundation, you have Nakopa, etc. So all of these have to be emphasized. Likewise, they do play an important role in guaranteeing or facilitating access. What, though, needs to be strengthened? I think universal health coverage is an end goal, and primary health care is a key component, and I think Tanzania has made strides in that respect, but much has to be scaled up, such as there's a shift from not only guaranteeing physical access, that I think Dr. Ogilo alluded to. We're always concerned with numbers. So many accessing and having physical access or proximity, but also, as Minister Mazrui touched on, we need a shift in mentality with regards to how health is understood, it is approached, it is addressed. And we don't need to pursue the traditional menu of the physical selective items. For example, you had questions about maternal and child health, immunization, communicable diseases, etc. But I think we need to move towards the SDG approach, where health and well-being is taken in tandem. And I think civil society organizations can lend a hand by virtue of the experience in this, in that they have a diversified approach in approaching health, accessibility, where they blend. If the example that I gave of the Jane Goodall Institute and their program of Takare, for instance, looks at issues of conservation from the point of social well-being. Zayadesa likewise looks at issues of youth empowerment, but also taking into consideration questions of their reproductive well-being. And TMARC, for example, has some revolutionary approaches in terms of, somebody talked about cost sharing, for example, of health in using social marketing approach, which I'll talk about more later, if I do have that opportunity.
Yes, I believe with time permitting, we will have that opportunity. I want now to move to Dr. Nyanga, who is the Director for Preventive Services in the Ministry of Health here in Zanzibar. Doctor, you oversee preventive health services in Zanzibar. And one major achievement that we saw in Zanzibar was during the COVID-19 vaccination process, where the performance in Zanzibar has been heralded as a good example, particularly built on very good partnership between the government and the private sector here. I hope I'm right on that one. You recognize that. So if you can, please, can you tell us what the magic was in Zanzibar for that exemplary performance? Because other people would like to learn as we look at the Omicron and Ninja emerging now. What was Zanzibar's magic in that partnership?
Thank you very much, moderator, for having to invite me to talk about the success that the Zanzibar had when it comes to COVID-19 vaccination. To start with, I may say that three things is actually accounting for the success that we have. First of all is leadership. Second is right partnership and approaches. And the third is through having a stronger community health program that is actually linking the primary healthcare services and the community in need of those services. In Zanzibar, we have around 2,300 community health volunteers that are all over Unguja and Pemba that are actually working in their catchment area, supported by supervisors that are situated at the primary healthcare facility level. These community health volunteers have been actually sitting on the forefront behind the success that we are talking about here today. And they have been actually trained, equipped, and linking those services that we're talking about in a way that the community themselves understand and are coming to the facility level, or they are coming to where they see the community outreach program are being implemented to get their shot. And as we speak today, yes, we are at 30% target of the population, and female outnumber male by 55%. And some of the region have actually do really great. In Zanzibar, for example, Kusini, Pemba, they have been actually leading. And as we speak, they are just around 10 to 15% to reach their target. And others, we still have work to do. So when it comes to community health program through community health volunteer, this is something that we can say we are proud of it, because they have been continuing supporting us to move and penetrate to the community that we are serving. I may elaborate more when it comes to right partnership and approaches. We have been actually using the community outreach programs where we do hire different vans, different time, equip them, put expert, as well as accompanied by these community health volunteers or guided by them in their respective community to go and educate those community members. And when they understand what is and how is it important for them to have a vaccination shot, they agree with us. And whenever we go for community outreach program is where we improve the coverage to these vaccination services. We have a number of health facilities that we have actually set them out to support these services, but what I can actually say I can actually say the way the community has actually perceived when it comes to getting the vaccine shot in the health facility is different when we actually follow them to their respective community through this community outreach program. So the partnership that we are actually having and the way we outsource this, because it's not only the government who are actually doing this, is also we invite private practitioner, NGOs, as well as other organizations that are interested to work with that on these issues, they are actually allowed. We have seen vaccination done at the airport by the Zan Medical, and these are the organizations that have been actually invited to do the diagnostic services, the laboratory service when it comes to COVID-19, testing those travelers as a prerequisite for their departure from Zanzibar to their destination. So them, they were actually doing. We have other folks from tourism industry who are actually working with us, where they did a good job, but also through the police as well as military, where they are actually working with the government, and they come to us and wanted to have this vaccine as well as experts, and they work with different set of organizations to move around to their community and vaccinate their population. So through that kind of approaches, collaborations, and partnership, we basically managed to have a bit improved coverage, because we are yet to attain the target that we want. Basically, we want to vaccinate 70% of the population, and our target is to have it completed or accomplished by December this year. So we are thinking through this partnership that I have actually explained might be able or enable us to reach and attain our target. And when it comes to the response to COVID-19 outbreaks, I might not be only talking about the vaccines, but also we have this area, the outsourcing partnership with a private entity to support some of the key services when it comes to COVID-19 detection. They were actually supporting. We invite them to come and support the COVID-19 testing, where we have Zan Medical, we have Alpha Care, Sunny Med Group. All of them are actually doing a wonderful job. At first, it was like many people were actually missing their flights. And it's just because of the frequent reagent stock out and defaulting of the machines. And because of the capacity that we have is limited, so we were actually facing that much mess very frequently. But upon inviting these other folks and letting ourselves dwelling much on the suspect, COVID-19 suspect, the service actually improved tremendously. Until today, we have a very good partnership that we even wanted to learn a good lesson from it and translate now to involve other routine health services that we are actually providing. So the COVID-19 vaccination success when it comes to Zanzibar, I think they are actually behind those. And the last component is about leadership, which I won't actually dwell much because everybody have actually seen from the national level up to the community level. The way presidents, honorable ministers, permanent secretaries, regional commissioner, district commissioners, but even share at their respective catchment area, they were actually remain on the forefront to push for the awareness and advocating for different community groups to be coming out and have to get their vaccination. That's all that I can say when it's come to.
A well-deserved round of applause, not only to you for telling us what you went through and how you did it, but also for the Revolutionary Government of Zanzibar for that exemplary approach in dealing with the COVID-19 vaccination challenges. But having had that experience, I believe that experience is built on a foundation of strong private sector engagement, other stakeholder engagement undertaken by the government of the Revolutionary Government of Zanzibar. How far do you see the model being rolled out in other areas of health provision in Zanzibar?
Thank you for putting these questions. And for me, or for Zanzibar, I think when it comes to PPP, this is something that has been previously addressed by previous speakers on the importance of PPP in Zanzibar. As we have actually said over here, we have even invited a private entity to come and work us through the COVID-19 response, as I have said. The Zanzibar public-private partnership is governed and managed through Planning Commission, and they have been actually mandated to develop legal, regulatory, as well as decision model that is actually guiding best on how we can outsource the medical service delivery in our public facility. And based on that, they have actually set regulatory framework and strategy that is actually based on the assessment of merit as well as demerit, and leveraging on the growing evidence on the improved accessibility, quality, efficiency, as well as cost reductions in the hospital operations is actually something that we might want to continue doing in order to improve the services to patient communities. And over here, I would like to encourage that maybe some of the services at the healthcare setting might be something to start with. Maybe like diagnostic services, laboratory imaging services, hospital management services, as well as some of the operational services. These are the things that we might actually want to see how best we could actually work with a private entity to improve. And I might actually try to cement this through a very vivid example that in Zanzibar, around over 10 billion Tanzanian shilling is being actually used by national health insurance to cater for their beneficiaries. But only around 15 to 20% is actually coming to the government side. So probably within the private entity, because they are actually taking much of the stake, there is something that we might actually want to learn and see how we could actually take that best practice and improve within the government facility the services that we are actually providing. It has been stipulated and said several times that Zanzibar now is actually seeing or taking the private entity as the real partner to come and work and cement the services that we are actually providing to the community in terms of the quality and affordability. So those are the kind of things that I may say when it comes to Zanzibar. We are more than ready to work with private entities to improve and attain the universal healthcare coverage. Thank you very much.
Thank you, Dr. Nyanga, for the lessons. I think the attendees have something to pick and take home from Zanzibar's experience in private sector and the other stakeholder engagement for promoting universal health coverage. And before we go for concluding remarks for all panelists, I hope you have points that you would, having listened to everyone here, I want to come back to Salma a bit, and in your area of gender and human rights as they concern health, I wonder if you have any word to say on strategic solutions, and please use this opportunity also to give your concluding remarks.
In fact, I do. One is around harmonization of the agendas and approaches, systems, priorities, particularly in a partnership where the role of the state sometimes seems to be in conflict. If you take the example, for instance, of insurance schemes or of health provision, you have a state or apparatuses of the state like the MSD, NHIF, which are quasi-state institutions, and then you have the government itself, like the ministry, and then you have a private actor. Then you do not really have a partnership of equality. So that somehow needs to be looked at with regards to accountability measures. There needs to be reconciliation of the micro and the macro. When you talk of the primary health care, you envisage it to be occurring at the base, locally. Yet, the framework for PPP mechanism, particularly in financing, happens at the macro level. You talk about the national level and not so much at the local level. So that dynamic, there's dissonance, and I think it has to be reconciled. Likewise, with regards to financing and investment, it is still very much below the Abuja targets. It tends to be erratic and it's not sustainable. And already one of the panelists has talked about sharing costs, but bearing in mind that it has to be affordable, yet the private sector thinks of profitability. And I think civil society can lend a hand in this, like I talked about social marketing approaches that organizations like TMARC has been exploring. Ongoing consultations and dialogues, open communication mechanisms to facilitate, but also to follow up such that all players are kept in the loop. And the relationship is so much that directing of what one partner is supposed to do. Continuous monitoring and assessment is another area of processes, of products, of performance, and of partnerships. And a key focus here should be on accountability of roles, targets, and delivery, as well as outcomes. And lastly, with regards to some of the solutions, would be stewardship. I initially spoke about rootedness and ownership, but to emphasize that is about stewardship, to ensure, and I think this is the primary role of universal health coverage, that people remain at the center of the partnerships, such that governments and corporations support the well-being aspirations of the populace. As to my closing thoughts, if I may, thank you. I want to underscore the ethical dimension or the ethical imperatives where non-commodification of health should really, I think we should really work hard to ensure that health remains a public good. And I say this in the midst of insurance schemes that are being promoted and concerns with efficiency, that the risk would tend to make health a commodity. It is up to the highest bidder, and we already see this in hospitals where the concern is with always opening new files and having more clients as opposed to the care that should be emphasized. The use of technology, I think leadership is needed there. There are a lot of options. Some have already alluded to artificial intelligence. And I think Dr. Gilo was talking about how we can optimize on this, telemedicine, digitalization platforms. And I think Dr. Ali will attest to the fact that Zanzibar is pioneering this in affording digital platforms with Afya Ni Jamii programs that has been used. But it shouldn't just be on the aspects of curative. It should also be applied in areas of operations, information management, and the whole breadth. Lastly, I think we need to make a case for comprehensive health packages, not emphasizing just treatment, but also prevention and promotion as well as well-being. There are a lot of health issues that are now emerging, and we have to grapple with those, but they should also form part of the options of the type of health services in demand. Specifically, you have not only cases of cancer, but also of mental health. I think it is not yet properly covered in a lot of the packaging that we have, and also questions of rehabilitation in view of not only accidents, but also of the growing population in terms of age. And I wish to lastly make a case for increased attention to not only maternal and child health, but also those of seniors.
Thank you, Salma. Very passionate comments. I'm sure they are being picked up for people to do more work on those. If I may come to Lusajo now for your concluding remarks, having listened to all the speakers before we go to the
As we know, health is a capital, and in order to increase the country GDP, we need to have the health society. But also, taking consideration, we need to ensure the issue of sustainability of the service provided as a government or as a ministry. We take in consideration in all our plan, especially in the health policy, and also in our strategic plan, the importance of private sectors, especially in both in urban and the rural areas, whereby in the rural areas we have those not-for-profit providers, but in urban we have for the commercial providers. And also this will also ensure in addressing the issue of universal health coverage. But not all of that, but also the government continue to create an enabling environment for joint border investment for health sector in order to increase the issue of accessibility and the quality of healthcare service. Because when we talk about the quality of healthcare in Tanzania, we need also to consider the role of private sector. For instance, we have KCMC Hospital, we have Buganda hospitals, and other, many of them, those private hospitals, which also contribute the effort toward attaining the quality of healthcare service. But not all of that. Also, we have some of the potential areas where as a government we need at least to get support from the private sector. We have in the area of the pharmaceutical industry, whereby about 80% of the health commodity we just import from abroad. So that means we import more than we exporting, where we experience the loss of the foreign currency, because most of our currency we just transferred abroad. So the important is, maybe for those investors, they should see the importance of investing in the area of health commodities in order to reduce the existing gap of the health commodities to complement the government efforts. But also when you talk about the issue of health service deliverers, there are a number of areas. As mentioned before, we have the issue of infrastructures and area of human resource for health, but the issue of diagnostic service through the change of technology. We know some of the medical equipment, they are very expensive to run. So the engagement of private sector will reduce the burden to the government to run, to maintain, and to finance all those medical equipment. And also the issue of training. We know we have the gap of about 52%. So how can we offer the best service under those shortages? So the key message that maybe we're still encouraging the private sector to support the health sector. As a ministry, we are conducting meeting with the private sector, with the forum, whereby we identify the area where our stakeholder can invest in. And lastly, I think apart from all the things we have, but the most important thing is the issue of enforcement. We have a good policy, we have a good strategic plans, regulation. So together with the private sector and the government, we need to insist on the issue of the enforcement. All these things will ensure the sustainability of the health service provided to the entire society, especially toward the attaining of the issue of universal health coverage, whereby we know most of the people, they are not covered within the health insurance. So maybe let me end it here for the concluding remarks as of now. Thank you.
Thank you, Sergio. Jacob from the UN Women,
thank you.
your concluding remarks, please.
Yeah. First of all, it remains to be important to acknowledge the role played by public-private partnership into fostering up universal coverage for health in Tanzania. So it's very important, first of all, to acknowledge and from there to think on where and how we can move forward in this kind of relationship. But also it's very important as we move on to consider, to still considering on how PPP can be improved in terms of gender mainstreaming, which is very crucial at this moment. Looking for example, the magnitude of some of the health problems like HIV in Tanzania. Going to statistics, you find that women are at high burden of HIV infection and HIV vulnerabilities. But if you come across the budget allocating for attending women priorities in HIV response or attending issues which prevent women to be in the needed welfare on HIV prevention or HIV response, you may find that it's not actually, there are no actually critical strategies which are looking at strengthening or maybe alleviating women from such diversity. So it's still important to consider the issue of gender mainstreaming if we want to make PPP a very strong pillar in healthy, universal health coverage in Tanzania by ensuring that there are priorities which are of gender mainstreaming at all levels, from budgets, from implementation, and all other issues which are critical to PPP involvement in the country. So that's all what I can say in summary.
Thank you, Jacob. That's the big message from you and women. Do all the partnerships you want or the engagement you do, but make sure you don't leave behind the vulnerables. Thank you. Dr. Ogilo, maybe briefly concluding remarks.
Thank you. One thing that I think we need to point out clear, back in 2018, the then President of the United Republic of Tanzania set up a committee, a technical working group, to look into how to improve the business environment in Tanzania. Among the 12 appointed, I was lucky to be one of them, of the team. And we did a very good work to look at the landscape of business environment, including public-private partnerships. And we came up with a very good document, the blueprint, that the following year was inaugurated. It pointed out a lot of things. Experts work on that. Excellent guys did a wonderful job. And that blueprint shows how we can move the country to the next level if we involve the private sector participation by building a good enabling environment. Unfortunately, as was said here in the morning by one of the people in the panel, who said, I think from UNICEF, that we have very good documents, we have very good policies, we have excellent strategic plans, but once they're done, we put them in the cupboards. They're there and left till they expire. If we go back and look at the blueprint, we'll see the importance of public-private partnerships. And the health sector is well documented, how we can do much more by having PPPs through the private sector, and how to support the business environment. So this is something that we need to do. But another thing that we also need to look into and need to agree on is that the Tanzania, the dream of Tanzania becoming a medical tourism destination. And let me commend Zanzibar. For all the years that I've been the CEO at AFTA, I've had 2 ministers who came to my office and just came to say, how can we improve our services through the private sector, and how can we improve the private sector activities? They were from Zanzibar. Sorry, my minister. They are from Zanzibar. They came and they said, how can we work together? And today was that when was being introduced, the minister here, who is also an investor in health. So he knows very well how health works. So I think to me that is, it just makes me look at it and say, we need to understand something by being part of it and getting engaged with the people who are in it. Then we can know better how to support them. So we need to have this more engagement, stronger engagement. But also recently, I remember what our president said, Mama Samia. She said, I remember it like, the private sector has to do the investments and the business. The government has to set enabling policies and to collect taxes. If we've got that mindset, then that we're all working together to enable the nation to achieve something. Just one concluding remark from another sector. A few months ago, there was a very big meeting of the top government officials. And they're looking at how to export avocados. Why are all avocados exported through Kenya, Mombasa port? And they said, we think we don't have storage facilities at the Rehearsal port. And the reason was, let's build cold rooms to export avocados from Tanzania, so that ships can take them direct from here and not to go through Mombasa. And they said, okay, that's good. I've got some interest in avocado business in one of the board, one of the biggest actually avocado companies in the country. And so the MD calls me at 6 in the morning and says, Abi, I got a phone call from this high government official saying, I've got good news for you. We are going to build up cold rooms at the Rehearsal airport, the Rehearsal port, so that we can now export avocados to Europe and everywhere from the Rehearsal port. I told him, they had a meeting. He said, yes. The question I asked him was there a person growing avocados exporting in that meeting? And he said, I tell you, my friend, you're just telling me what I asked him, what I asked the top level person. And he said there was none. There were only the government officials. Then I just told him, my friend, why do you wake up in the morning? He said, because I wanted you to understand what I'm going through. The reason for using Mombasa port is only one. We don't have enough cargo from Dar es Salaam, so all ships from Dar es Salaam go through Mombasa. And then they can spend some weeks between here and Mombasa, then they park in Mombasa. So when you park in Dar es Salaam, it might take a week, or even 2 weeks, or even a month. You are still stuck at Dar es Salaam, your cargo is not going. But if you got Mombasa, that's the departure point. So you take the cargo just the day or two before the ship leaves. When we pack avocados, the containers have all got refrigerators. We don't need a cold room. So now this is a problem. When trying to sort a problem without involving people. So the best thing for us to move forward in universal health coverage, let's involve everyone in the planning. Let's work together in the planning. Let's sit together and we're going to achieve it. Thank you.
That's the private sector magic. Thank you, panelists. Oh no, I still have Nyanga's concluding remarks. You have anything to say, sir?
Thank you. I think at this point in time, all healthcare organizations and agencies, including Revolutionary Government of Zanzibar, needs to move away with being a transactional agency and embrace the transformation through learning best practices, lesson, and embrace the right partnerships that we have all seen. There is an increasing evidence that the PPP is actually working. And this is because we have been actually seeing tremendous pressure faced by healthcare organizations, including this hospital, and challenges in delivering affordable and high quality healthcare services that are actually failing to meet the community expectation. In order to move forward, we need to rightly do the partnership and right collaboration in order to sustain and move the healthcare services that we are actually delivering to our community in this model that are actually now being recognized that this is something that is not like an option, but is something that we must actually do in order to meet community expectation as well as attaining universal health coverage. Thank you very much.
Thank you, Doctor. Thank you very much. We have heard from the panelists the key messages that I picked from those. One is we have all stakeholders a shared vision as to regards quality universal health coverage. There is a point being made that there is no way we can avoid collaboration, PPPs. Even if there was someone in government who wanted to not have PPPs, the government simply cannot afford to take the burden on itself. So we must share that burden. The private sector must come in. From what we have done, from our histories, we have had good lessons and experiences that we can apply going forward. And there is a need to look at health financing that can facilitate indeed private sector participation in the provision of health services. So thank you very much, my panelists, for that. Before we go now to the plenary discussion, I understand there is the Minister for Investment here in Zanzibar who has a particular message to share about Zanzibar's experience in that area, private investment in health provision. I think it's time, if you can, Honorable Minister, take the floor.
Thank you very much, moderator, and congrats to all the panelists. I've been listening to the discussions very keenly, following on the deliberations that have been going on regarding PPP. As a way of introduction, my name is Modric Soraga, and I'm the Minister responsible for Labor, Economy, and Investment of the Revolutionary Government of Zanzibar. I just had a few remarks, not a particular message, but just to add value or context to what has been deliberated from the morning session until now. I think broadly speaking, what we have been deliberating on is how we can adequately engage the private sector to be one of the major players within the health sector. And just as a point of, to begin with, just as a point of correction, the PPP portfolio, in the beginning, it was under the Planning Commission, but now that portfolio has been moved to our ministry, so it is directly administered under our ministry. Generally, what I wanted to highlight is on the the complexities of this particular area. I mean, we are talking from a policy standpoint, which on a ministerial level, that is our key function, is to ensure how we execute the policy. But there's limited discussion on the technical standpoint. And it's also crucial that we put much emphasis and focus to kind of highlight what are the issues that are going on the technical side. PPP is a relatively new concept here in Zanzibar, and so far as we are speaking, we have only 2 projects that have been implemented through this particular format out of the 15 projects that are currently being deliberated on. So you can see even the speed of implementation of these projects, the deliberations of it take a lot of time, and this mainly has to do to the technical understanding, the know-how of how to negotiate on these projects. And I have a background in business, and I can honestly say I don't understand half of the things when we come into deliberations. So as much as we are focusing on the policy, and it's very important that we also develop capacity even for policy makers to understand, at least from a general standpoint, when you go into negotiations on these particular sensitive issues, that at least you have some level of understanding on these matters. So the Revolutionary Government of Zanzibar, under the 8th phase government, has taken deliberate measures, first of all, to review our laws, to review our policies, to set up better guidelines for PPP implementation. And one of the areas that we have focused on is, first of all, to establish a special unit under the Attorney General's office called the Government Negotiating Team. This is a unit that is comprised of the Attorney General as the chairman, but it also comprises of the different directors from planning, from the Zanzibar Investment Promotion Authority, the permanent secretaries, as well as lawyers, especially those who are dealing with commercial law and other things like that. And then the other area that we shifted our focus on is to review our laws to make them more friendly, especially for what we call unsolicited projects, to protect intellectual property for unsolicited projects, to make sure that they're not subject to competition in case an investor comes in with an unsolicited idea. With the previous framework, the way it was a bit of a challenge for most of the investors, because of their worry that if I bring up an idea, then I'm going to be subject to a tendering process, which under normal circumstances, you would have to compensate them. But the circumstances in reality are quite different. So there's no compensation, but then you also lose out on your idea. So we've made the reviews of the law, and this was done early last year, and it's been a revelation, because now it has opened up doors, attracting more interest from private investors who want to come in and collaborate with the government in PPP projects. We understand the need that is available for funding in public services. And so this has been very good for us so far, and we are continuing very well. Another issue that I wanted to highlight on is on the issue of conducting feasibility studies. And this is the ideal scenario would be if the government itself can be able to fund the feasibility study. which means you have more leverage in terms of when you are coming in to negotiate. But unfortunately, if you look at most of these PPP projects, they are very capital intensive, which means even on the feasibility study, the detailed design, coming up with a bankable feasibility study. First of all, it takes a lot of time, but also it's very expensive. And so this is one of the areas where we try to make it very clear to our investors that in terms of the feasibility study, that this is something that they should take on board. And we are grateful so far for all the 15 projects currently being negotiated under the government negotiating team. The investors have agreed to conduct the feasibility study. We are lucky that in the beginning we had some assistance from the World Bank, where we received some funding to conduct feasibility study in around 13 projects. So that has been a bit helpful, and we can see the leverage that we have in those areas because we already have an existing feasibility study. On the procurement process, this is a very touchy subject, and we also are trying to be as clear, as transparent, and as open as possible. I know there's a lot of confidence building measures that we have to take into consideration to ensure that there's fairness, there's openness, and that logic applies. Sometimes when you go into these processes, you can be disqualified for some very minute reasons, and this is something that doesn't help in terms of building investor confidence. So these are the areas that we are trying to improve upon, and I would like to extend our sincere gratitude to the Project Management Institute, PMI. We had a meeting with them a couple of days ago, and they have shown their willingness to work with the ministry to build capacity of our staff to make sure that they are up to par with the global international standards of managing projects, and as well as the UNDP. They've also been our very close partners in this area, and as well as the World Bank for their continuous support for capacity building. So the broader overall environment for the applicability of PPP in Zanzibar, I would say it's a continuous learning, growth process, and in doing so, we believe that things have to start somewhere. So we've started this journey. It's very positive, and I think that in itself is something that we can take a very positive outlook that we've started this journey and we are heading in the right direction. Another thing that I wanted to emphasize on, particularly with the health sector, and I'm grateful that the minister is here because I called the meeting last time and he wasn't present. And I wanted to emphasize on the need for government communication, internal communication. We've talked about enforcement. When it comes to enforcement, it's all relevant institutions. We all have to be on the same page. We all have to be thinking, sharing the same information, whether it's a regulatory issue or a legal issue. We have to have that common understanding. And we have to be honest that there's a bit of a gap in that area in terms of government communication and government entities being on the same page and speaking the same language. And if we are able to achieve that, then at least our potential investors that are coming in, they wouldn't have any problems in terms of our decision-making process and making sure that we provide timely decisions that are, across very well known between the entities. So we have a number of initiatives that we have put forth, and also I would like to extend our gratitude to the European Business Council. They will be assisting us in preparing an investment blueprint, and mapping so that we have the general picture of the state of PPP projects within the country. And then the blueprint, we believe, would solve our communication issues, where it will be some form of a one-stop shop where all the information regarding PPP, the regulatory framework, the legal framework will be well known, and sometimes even beforehand or before the investor wants to make a decision. On health, it's very important also to include the issue of community. And I like to use this term as public-private community partnership. This is a component that I think when you are talking about a particular sector like education or healthcare, the community engagement also has to be very profound. The engagement has to be there from the beginning. And so at least, even if you're talking between the government, public, and the investor, but the community as well has to be there from the beginning. And I think I will end there. Thank you so much.
Thank you very much, Honorable Minister Mazrui. What's
It's Soraga.
Soraga. Oh, apologies. My apologies. Maybe it's because we'll be hearing from Minister Mazrui again shortly. We can now go to the plenary. And the way we'll do this is you'll put your hand up. I hope I can see you from here. And then we will get going. Okay, I see a hand there, I see a hand there. Okay. As we are running a bit behind time, I don't want to hold people here for too long for lunch. I will, yes, they are very important people, I know. I will ask that we ask questions quite briefly, and so that we can move on. I've seen Florence Thames' hand. I recognize you from AMREF. Please take the mic. You'll be the first speaker.
Thank you, Chairperson, Chairman, so to speak, and the panelists, and the only lady panelist, and the audience. She needs to be recognized. Okay. Thank you so much. Actually, talking about universal health coverage is rather a platform for SDGs, where we are saying leaving no one behind. And I think the discussion around PPP, I must say I really applaud the government of Tanzania, just as how Ogilo said. Nowadays, discussion, many people on the board, and the police also welcoming new ideas. It's not the way it was before. But, and also we who are coming from non-state actor group, we are also engaged and really appreciate that. But I keep feeling that there's one partner who is missing. And it has been mentioned, but the way I see it mentioned, because this partner is seen as a beneficiary on the demand side, a recipient of services. I think now it's time that should be seen as an integral partner in the PPP model. I think the former minister just mentioned it, that the community should not remain as a recipient of the services, but an integral partner in discussing about PPP models, because actually they are engaged, but are they part of the plan? Are they recognizing the policies? The policies making, even the plans that come out, do we know how much the community X has contributed in particular development that has happened in that community? We have models, and maybe it's a way of sharing, but like AMREF, I know in Kilindi, there's a community that mobilized themselves and put a dispensary in Lusane district, and that made everybody come on board, donors, government, etc., because the community decided and they put their initial funding. So I think this is a kind of emphasis and sharing. We should inspire other communities, but particularly this is also a PPP. We should see that way as well. So talking about resource mobilization, I think we should also recognize what we call individual giving, because each individual has a role. It's a responsibility, and that also brings in the ownership that we're talking about, the ownership, but commitment, and might also promise the sustainability, because then you feel I'm part of that. And I think the same has to go ahead together with the universal insurance scheme that we're talking now, that it has to be compulsory, that everyone has to have it. And I think also need to promote the philanthropic approaches that it's happening in the Western world, but here also there are people who can actually participate in resource mobilization and should be recognized. So, and I think the PPP models, they should also be more on a need-based. What's the community actually, the beneficiary or the so-called end users of the commodity or services need? It's not just because there's a corporate here wants to do the CSR, but basically it should be something that is based on the needs of the beneficiaries. And talking about that, we also have this mobilization that, like Amber, the way we do, mobilizing individuals, corporate donors, and now the government, like a diamond model. I think something that we can actually, at the end of the day, everyone is not left behind. It's all, everybody has been involved. We've seen in sanitation marketing, where through that approach of the diamond model, people actually demanded to have good, better toilets, better latrines in the household level, moving from 21% of people with latrines to 41% in Mwanza, some of the remote areas. So I think the more the community engaged, the more they are recognized, the ownership is built. Thank you.
Thank you very much, Dr. Florence, for that good contribution. I didn't see Mark's hand. Mark, do you still want to speak? Yes, that's the end I saw. Get the mic.
Thank you, moderator and honorable ministers, distinguished leaders and guests.
Introduce yourself.
I'm called Mark.
I recognize you.
The country representative of UNFPA, the UN's Sexual and Reproductive Health and Rights Agency. And it's a pleasure to be here with you for this symposium this week. And really, I believe, part of a celebration of His Excellency President Mkapa's legacy. And really, as one of the great sons of Africa, a commendable statesman who not only worked to advance and transform Tanzania, but also had great contributions at the regional level and at the global level in paving the way for UHC. With the honorable ministers of health present with us today, really allow me also to recognize the government's commitment to supporting and promoting sexual and reproductive health and rights. And really to highlight that there cannot be universal health coverage without universal access to sexual and reproductive health and rights, and vice versa. You can't have UHC if you don't have access to SRH. And when we recognize the human resources for health challenges that are being faced and discussed, as UNFPA, we've partnered with the Mkapa Foundation over the last few years with the valued support of the United Kingdom through FCDO to be able to support the government to ensure continuity of reproductive health, maternal, neonatal, child, and adolescent health services, especially during the period of COVID-19 pandemic. And through this support from the UK, from FCDO, we've been able to support healthcare workers in more than 170 health facilities, 11 regional referral hospitals, around 22 regions of Tanzania, and across 26 ports of entry into the country. As UNFPA, we're continuing to continue that partnership with government and with partners, including the private sector, particularly to address poor maternal health, which is often influenced by the high number of unintended pregnancies, and particularly teenage pregnancies. And moderator, if you allow me one closing remark I wanted to share as we're celebrating the legacy of His Excellency, the late President Mkapa, was really to highlight the role that he played in also shaping the United Nations as a system and as a family. And many of you may know or may not know, back in 2005, the United Nations Secretary General appointed President Mkapa to serve as a member of the high-level panel of eminent persons on the United Nations system-wide coherence in the areas of development, humanitarian assistance, and the environment. This was a panel that sought to promote how the UN can better coordinate and work together in delivering our programs at country level. This is what led to delivering as one, or the One UN, as we're often referred to, about strengthening complementarity, about enhancing efficiency, and avoiding waste and duplication. And really, this One UN system is very mature and alive here in Tanzania. And it's something that is a legacy of His Excellency, and something that, as the UN system, we're very grateful for his leadership and contribution towards. Just in closing, I think this is evident by the UN family that's here with the Mkapa Foundation this week. From UNICEF, the World Bank, UN Women, UNFPA, we're here to support these efforts and continue with the country on those strides to reach UHC for all. Thanks very much.
Thank you, Mark. Thank you for your contributions, and particularly reminding us of His Excellency's contribution at the global level. It's not only the work that the BMF is doing locally, but the contribution that we remember today include that, what you have just said. I had seen Steve, you will forgive me for I'm picking the people I can recognize more. I saw Steve Muhando. Please.
Distinguished members of the panel, government officials, as well as all here present. My name is Stephen Muhando. I am a communications and public relations manager from Anglo Gold Ashanti Gator Gold Mining Limited. But today I represent our Vice President for Sustainability in Tanzania and Ghana, Simon Shayo, who sends his regrets because he couldn't be here. First of all, I wanted to commend all the panelists, as well as Benjamin Mkapa Foundation for the invitation, as well as the wonderful event that they're hosting here. But beyond that, just to give a brief background, I represent rather GGM, which also stands in the Chamber of Mines, the Tanzania Private Sector Foundation, but as well the UN Global Compact. Now, just to go back a couple of years back, that was 2017 in July, the government, rather Parliament, passed an amendment to the 2010 Mining Act, introducing Section 105, which required mineral right holders to create jointly with the local government authorities a corporate social responsibility plan. Now, this plan ideally would be implemented within the local governments, or rather the district councils within which the mineral rights holders' operations lay. For Gator, which was the first in the mining industry to implement this government regulation in 2018, developed, of course, this CSR plan. But prior to this, of course, the company has been operating in Tanzania since the year 2000, particularly under the name Anglo Gold Ashanti Gator Gold Mining Limited. And it's poignant that we are here on this most auspicious of occasions to, of course, celebrate the legacy of Benjamin Mkapa, God rest his soul. But he was also the first, rather, to inaugurate this mining company, which employs me. And over the years, even prior to this amendment of this Mining Act, Gator Gold Mining Limited has always contributed a corporate social investment, and not necessarily within Gator region, but even beyond. For instance, we look at Kagera, where since the year 2015, we had supported the Jubilee Medical Boat in a partnership with the African Inland Church and the Vine Trust of Scotland. Now, this medical boat, for instance, plies its trade along the islands surrounding Lake Victoria and supports medical provision for these residents across these islands. And beyond that, looking at the health, the HIV challenge in the country, since the year 2002, we've had what we call the GGM Kili Challenge, which is basically a way that we support the HIV and AIDS response in the country in collaboration with TACAIDS. Of course, supporting government initiatives to reach the 3 zero targets. Basically, 0 new infections, 0 deaths, as well as 0 stigma. Now, why do I say this? You look at this corporate social investment. At the present moment, it seems as though the extractives industry as a whole, that's mining, oil and gas, is increasingly seeing, rather the local government authorities are increasingly seeing this corporate social investment as a tax. And in a way, you look at the fact that we feel rather that there is an opportunity here. Should, of course, I know there are lots of policymakers here, find a creative and innovative, as our theme says, inspiring change through this innovation, to look at how they can create a more enabling environment for the extractive industry to diversify this corporate social investment beyond the host communities within which, of course, these companies lay. Now, you look at, for instance, since 2018, our company has supported annual corporate social responsibility plans of over almost 9.2 billion since 2018. Now, looking at the advent of, let's say, COVID-19, where Gator Gold Mining Limited also supported government efforts to curb the pandemic with a contribution of donation of over 1.5 billion Tanzanian shillings. And this, of course, if we diversify, could also support, for instance, one of the panelists was talking about insurance for Tanzanians, or rather people living in this country. So these are the underserved, within which, of course, this is the motto of the Mkapa Foundation. So the call here is really to continue to support an enabling environment for these companies to diversify this investment and not to look at it as a tax. I really want to extend my appreciation for this opportunity. Thank you.
Thank you, Steve, for that information. I know we still have a number of hands, but we for sure almost out of our time. So I will take 3 last speakers. One will be Sharif, and then I'll have Honorable Megji and conclude with Madam Shadia Karume. It's just those 3. Please, I will do with, if we have time after the 3, then we can come back. Sharif, you left the room? Okay, you are not available. Please give the mic to Madam Honorable Meg Zakia. Mheshimiwa Umi, unaweza kuwa na bahati, Sharif amepotea.
Yeah, thank you very much, Mr. Chairman. And let me say that to see you just so, the Ministry of Finance. And secondly, let me commend the Mkapa Foundation for this symposium. But let me also say that I'm very proud to have worked under President Mkapa for nearly 10 years of his service. I have basically two things, and let me point out the panelist who is sitting on your left. A very interesting presentation, of course, but there's an issue. One is on innovation. And pointed out that innovation usually comes with the private sector, not like the government. I tend to differ on this statement because I would say that were it so, then would have found the private sector in all investing, for example, in the district hospitals, you see, dispensaries and whatnot. But this is not the case. And I think that the private sector would go where the government has shown the way also through the policy. And therefore, I would think that the government would want to take risks because it is the government that represents the people and would want to retain in power. So basically the risks, I would see that more risks will be taken by the government. The private sector will best go to those areas where they feel that, because it's a business also. The hospitals here are business, and that is why somebody talked about the Aga Khan Hospital, And we know that, for example, that even the national insurance cards, for example, in some of the hospitals, they don't take the national insurance cards, and that is for the minister to say that. The other one is that the pointed out that got you correctly. President Samia Suluhu said that to prepare policy, and the government will act on them. But sure that, and I know that there are several policies, you see. I don't know which country, if I'm correct, in quoting you like that, I don't know which country will just have policy and the government to act on that. Especially on social services. They make services, economic projects. But I don't think, and that's why even when you read of the history of President Barack Obama, when he the health services for all, I think this was a big challenge also, And therefore the government has to, actually. And that is why even COVID money, for example, COVID money when it was given to the government, it was the government dispensaries and whatnot, the send equipment, all those things, So these two issues, one is on the question on innovation, and if I was saying that you talked about CT scans and MRI and whatnot, if my mind goes correctly back, because I have also been Minister for Health, but I think, if I'm correct, CT scan was ordered by the government and it was put at Billy Medical Center. Thank you very much. Asante sana. Tumenjoy.
Asante sana, Mama. Now, my secret why I were quick to see the hand is now. She was my boss at the Ministry of Finance, so I can't forget that hand. Mama Shadia Karume, please, and then we'll come to Minister Umi.
Alaikum. Ministers,
Can someone help with the mic, please? Yes, thank you.
I think it's not working also. Can you help me? Good afternoon. Can you hear me? Ah, yes. Okay. Good afternoon. Honorable ministers, moderator, panelists, fellow participants. I'm very happy and very thankful to be invited in this symposium. I thank again Mkapa Foundation to organize this symposium in Zanzibar, and also thank the government to have this symposium in Zanzibar. I've been listening to the panelists, to the speeches about P, and I think it's a very good system, but there's something which is missing here. But thank you, Madam Salma, you reminded that thing which was missing. There is the government, the investors, the community, but also there are foundations, NGOs, and CSOs. These play a very big part in this partnership. As we see today, what and who organized all this discussion? It is the Mkapa Foundation. May God bless him and rest his soul in peace. So what I'm trying, I won't take longer. What I'm trying to say is CSOs and NGOs play a very, very big part in supporting our government to reach their targets. We are the bridge between the government and the grassroots. So the grassroots have a lot of trust in NGOs, foundation, and CSOs. So what I'm reminding is that we are playing a very big part in helping the governments reach their targets. I haven't introduced myself. I'm Shadia Karume, chairperson of an NGO called Zaidesa, which tackled the socioeconomic problems targeting the youth, especially young women. It deals with their education, it helps in their education, their health, and also awareness in the environment where they're living in. So what I'm trying to say is this. If we are given support and we work together with our governments, which we appreciate the government is working with us, the government, investors, and the international organization, we can do a lot to help our countries. Thank you very much for listening to me. Thank you.
Thank you, Madam. The last speaker for this session will be Honorable Umi Mwalimu, and then we'll hand over to Honorable Balozi to move for the next session. Karibu.
Thank you very much, Mr. Moderator. I would also like to thank the panelists in order to accelerate a strategic health transformation in Tanzania through PPP. And I'm going to be very brief in order to reaffirm the government of Tanzania's commitment to work with the private sector in order to deliver better health outcomes in Tanzania, especially the marginalized household in rural areas. As a minister responsible for health, of course, I do understand the challenges in the health sector. There are too many, from the infrastructure, lack or limited medical equipment, human resource for health in terms of production and retention, addressing communicable and non-communicable disease. So the government alone cannot deliver better health outcomes. So the role and the participation of the private sector, including the farm, the government commitment to work with all of you. And from my president, Samia Suluhu Hassan, she made it very clear. The private sector do and deliver, let the private sector do it. So from the Ministry of Health perspective, we will comply with Her Excellency's instructions or directive. But a message also I got from the panelists. We don't fall short of policies, strategies, protocols. We have everything in place. Dada Maniza, Shalini, I don't know why I call you Maniza. I think I have to bring Maniza back. Shalini made it very clear. So that's why I requested for the floor to say that, once again, to confirm to you to implement what should be implemented in order to have better health outcomes for Tanzanians. However, I would like to challenge the private sector. Consider also working in rural areas. Because when we talk about private health facilities in Tanzania, Dar es Salaam, Arusha, Mwanza, parts of Kilimanjaro, you don't even find good private health facilities in Katavi, Rukwa, Kigoma, Manyara. So when we talk about private sector participation in order to achieve universal health coverage, you should also be willing and ready to work in rural and urban setting. But also, now we need also, Shalini has also mentioned about working, even Dr. Ndugulile, about also investing on preventive services. Now, everybody in Tanzania, in many private sector, they are opening dialysis center because they want also to get, I'm so sorry, maybe I'm not going to be aggressive here, I'm not going to be rude, but why there is also mushrooming of dialysis centers in urban areas? Why don't we invest on preventive interventions if we want to save lives, if we want to deliver better health outcomes for Tanzania? So my office, it is an open door policy. Come, the private sector, come to the Ministry of Health. Lusajo made it very clear. We have the policy, we have the strategy, we have the protocol. Come to me and tell me, Minister Umi, this is what we want to do in the private sector in order to achieve universal health coverage. I listen to you, and I promise we will implement as long as we are going to save lives of poor and marginalized Tanzanians, especially women and children. Thank you very much for your time.
Thank you, Honorable Minister. Thank you very much. It's always good for partners to understand what the motivations of each of the partnership, each member of the partnership. So I'm sure Dr. Ogilo has heard that, and he will speak to his counterparts, to his constituents. Let me thank BMF for organizing the session, the symposium, and for choosing me to moderate this one. It has been a learning experience. I thank my panelists for the very good introductions that you have made in coverage of the subject before us. I thank all the discussants, everyone from the plenary who contributed. And Honorable Balozi, I hand over to you. Thank you very much.
Please remain seated. Please remain seated. I still want you on stage. Thank you so much, the moderator and the panelists and the commentators. You did us very proud. I have two announcements to make when we are approaching the end. First one is to ask you to also join us tomorrow. Tomorrow is a day 2, and it's a high-level segment with Mkapa Legacy. And we are expecting the event to be graced by His Excellency Samia Suluhu Hassan, President of the United Republic of Tanzania, and closed by His Excellency Dr. Hussein Ali Mwinyi, President of Zanzibar. We will also have a special guest, His Excellency Joaquim Chissano, former President of the Republic of Mozambique. So we ask you to not miss to join us tomorrow. But second, soon after here, we invite you to have a lunch with us, and it will be served in 2 premises. I request ministers, panelists, former first ladies, Mama Mkapa and Mama Karume, board members of the BMF, PS, permanent secretaries, and sponsors to proceed to immigration room inside the hotel. And because the space is quite limited, the rest of us will have a lunch on the tents, inside the tents that we had a breakfast today in the healthy break. So those are the 2. Now it's my singular honor to welcome Honorable Mazrui, Minister for Health, to just give us a few words of closing before we depart from this premise. Thank you.
Honorable Umi, Minister for Health, Tanzania, Mama Benjamin Mkapa, Mama Shadia Karume, Principal Secretary, and all the guests. Assalamu alaikum. I'm happy to see that nobody is tired. Since morning we've been listening, but we were very actively. This is the good of this symposium. Thank you very much. I don't want to waste most of your time, but I would like to take this opportunity, first of all, to thank our moderators, Dr. Faustin Dugile and Dr. Kamblisha, for a very good job they have done. I think everyone has witnessed how much they have been working since morning here to moderate the whole session, and it was well done. Less applause for them. Not only that, but also I would like to take this opportunity also to extend our gratitude to all the panelists. The discussion, which was very live discussion, and I believe that everyone here has been benefited from the discussions here, and we say, panelists, thank you very much. Well done. Let me also conclude by saying that also all the guests here, the audience was very live. We have got many people who raised their hands and pointed out very important issues, which I think is going to be useful for us in this symposium. This symposium has brought here today the real meaning of PPP. Benjamin Mkapa Foundation is really translating the late President Mkapa mission in action. He was a champion of privatization and formation of PP in Tanzania. I remember the first day when we met at the hotel. It was that time it was called Sheraton Hotel. The first meeting of Business Council, I was amongst the member of the Business Council in Tanzania. I was a member of the private sector Tanzania. I was like a salt. I'm in every dish. So President Mkapa came there and said, this is our first meeting today. We are meeting this side. This is government. We are government. We are bureaucratic. We have a lot of proud that we are government. But today I'm keeping together government and the private sector, this side. And it's true. We had minister. I remembered when Madam said that I served his minister for 10 years. She was there at that time. We had all the ministers on this side, and we had business community on the other side. He said, and I quote, that do you know why we are here with the private sector? Because private sector is the engine of growth. This is what the late President Mkapa has mentioned to us, and I can't forget this. I'm always asking myself that this engine should now drive the vehicle. It should not be an idle engine. It should be an active engine to drive the vehicle. So in all today here, we've been discussing about the partnership between the public and private sector. Some have come with the idea that also we need to see the partnership between private sector and the private sector. And partner between private sector and private sector is not a complicated issue. We are working in partnership. We're forming a company. Madam can have 20%, have 30%, 60%. But always difficult was between public and private sector. So here today, we had a wonderful discussion, and I believe that from now, there'll be no point of hesitance that why should be working together, private and public. We in Zanzibar already started. We are working in the Ministry of Health. We are signing memorandum of understanding. We are signing contracts, and some they're in the pipeline. We need to be the first to do that, and we are doing that. Private sector on health and medical service is very important because health is for all. Health is for all. We have to invest, all of us, on health. I'm very thankful to Madam Shadia Karume, who mentioned about Zaadesa. Zaadesa, Wajamaa, and other NGOs and CBOs, they're working with us in many aspects. And really appreciate, especially on capacity building and also renovation of our clinics and supporting us during the time of mobilizing activities of collecting blood, mobilizing activities of outreaching. They're helping us. But it is very important that the government commitment should be shown here. I'm very happy to see that my sister, my counterpart there, Minister of Health, has shown here her readiness to work with private sector. And I here declare our commitment of both Ministry of Health of Zanzibar and Tanzania that we are committed to work with private sector. In Zanzibar, we welcome investors to come to invest on building hospitals, opening hospitals, diagnostic centers, pharmaceutical plants. Also now, we are grading our dispensaries and our hospitals. Like hotels, *1, *2, *3, *4, *5. Also, will issue licenses because it is done here. You see doctors with briefcases going to the houses and treating people, and some are not doctors. So all doctors will treat even from house to house, will give them licenses to control having false doctors who are treating people with false treatment. So please welcome. We are committed to work with you. As my friend said here, that somebody has knocked the door and asked if you can work together. Now, also, you have to knock our doors. Because maybe you have better ideas than us. But I say, opportunities are plenty. We cannot work all over. We should produce our own oxygen. We should also run and manage incinerators, laboratories, images, emergencies. How can we do all this? Somebody can come in Zanzibar and open a very big incinerator whereby all the hospitals, they dump their debris there, they get burnt very well and in a very good manner. This needs a typical management. We cannot just keep incinerators in every hospital incinerator. Opportunities are there for somebody to come and open incinerator plant, and we can work with him. We'll give them opportunities, incentives. Also, we'll give them business. This is business. But our business should be on win-win situation. On behalf of the Regional Government of Zanzibar, I would like to commend Benjamin Mkapa Foundation for the good job they are doing and the collaboration between Benjamin Mkapa Foundation and Zanzibar government. We really appreciate for your initiatives, innovative. We say thank you very much, and we thank you for conducting this very important symposium in Zanzibar. Thank you very much. We welcome you. Be with us. Also, we are committing ourselves that we are going to work with the Benjamin Mkapa Foundation every step, shoulder by shoulder, for the benefit of the people of Tanzania. Thank you very much, and good afternoon.
Round of applause to Honorable Minister. Thank you so much. The message is very clear. PPP is the smartest and surest way to go going forward. Commitment from both ministers, from the both governments. Thank you so much for that. Just another, a repeat actually of the announcement regarding the lunch. As I said earlier, former First Ladies, ministers, the family of late Benjamin Mkapa, board members of the BMF, senior government officials, permanent secretaries, members of the diplomatic corps, and our sponsors should proceed to immigration room inside the hotel. The ushers are here to take care of you. The rest of us will meet at the tent where there's a more room to mingle and network. So after saying that, I thank you so much for the day spent so well, for the discussion that we had, and for being very supportive audience. It's my first time to moderate, and I'm happy that you supported me so well. Even when technology failed me, you did not fail me. You stayed on us and you trusted me. Thank you so much, and looking forward to meet you tomorrow. Have a good evening, good afternoon, and good evening. I may relieve you from the stage. And just one announcement, Dr. Marina Njelekela, I have a message for you. Please see me. Thank you. Panelists as well. Panelists, join the immigration room. Panelists, please.